commissioner role of passion for improving the health of all Hoosiers beginning before birth. Dr. Box is a leading champion of Indiana's efforts to reduce infant mortality and advocates daily for better health for all Hoosiers, especially mothers and babies. Some of her accomplishments include building the first multidisciplinary women's center in the Community Health Network, developing critical partnerships with area children's hospitals to improve care and decrease health care costs. She also has led efforts to ensure that low-income women receive the important free health screenings they need. And she has served and is serving on the Indiana Perinatal Quality Improvement Collaborative, which is an advisory council to the Indiana State Department of Health and is comprised of more than 300 statewide community professionals working to reduce infant mortality. She's just a regular gal too. She's a loving mom, wife of 35 years to David, and she's a mother to 4 adult children. Will you please put your hand together and join me in welcoming Dr. Boss, we'll call her Chris for right now, to Northwest Indiana.
Thank you so very much. That was so kind of you. So this is such an exciting audience to be in front of because, you know, I am the State Health Commissioner, just finished my first year. But for 31 years plus, I've been an obstetrician gynecologist. So my whole life has been about seeing women at all stages of their life. And it has been absolutely the most rewarding career any woman could have ever asked for. I would never have left this career. In fact, when Governor Holcomb came and his team asked me to come and interview for this, I said, oh, I don't have my master's in public health. I'm not the right person for that job, but I want to keep volunteering. I want to keep helping. I really have a heart. I spent a lot of time doing missions trips to Haiti and Bolivia in my younger years, surgical missions, and I decided more recently, prior to taking this job, that my mission was going to be closer to home. It was going to be that Indiana still had one of the highest infant mortality and maternal mortality rates in the nation. And I was so disappointed that after all those years of practicing in this space, that we hadn't made an impact on that. And so I was very involved with substance use disorder at our hospital in pregnant women and neonatal abstinence syndrome, which is when babies go through withdrawal. We'll talk a little bit more about that today. And really got to meet the governor's team, Dr. Walthall, who's head of FSSA, got to meet a lot of the senators and representatives as I testified. And I think that's what led to this job. But as I originally said no to the job, then they called me back and asked again. It was my daughter who said, you know, because we train them, right, Laura? And then they come back and speak those words back to you, but they said, you know, Mom, God keeps opening this door. Maybe sooner or later you're going to have to walk through it and see what he's got for you. So, you know, I think God does have a plan. My husband retired. I was thinking more along the retirement lines. And I told my CEO of the hospital, I said, I love what I do. I'm not prepared to leave. I didn't want to leave. This isn't what I was looking for. And he said, don't you know that's when they always come looking for you? You know, and you've got to be willing to walk through that door. So the job is amazing. It's overwhelming. If it was just about women and children's health, it would be the easiest job in the world for me. But it's also about hepatitis and emergency preparedness, and it's about all those other things that we do, which are also really important for the health of the state. So I'm going to talk about a few of those today. I want this to be very relaxed. If there's something that's just burning and you want to talk about it before or question it before we get to the end, please feel free to do that. I'll be very relaxed about that as we go forward. I'll get through what part of my slides I can. I have to tell you, you can go to the next slide. Our State Department of Health is all about statistics and data. Okay, we are all about collecting data. So if you ever want data on anything, your infant mortality rate, you know, how many women go home breastfeeding, anything you want, hepatitis, whatever you want, we've got it. So reach out, we can give you that if you want it. But my team tends to put together a very data-driven report. So what we'll try to do is go through some of it. I want to give you a few stats that I think are important to understand where we are, and then we'll try to talk a little bit more about the faces behind these diseases and these issues and these problems that we face in our state. The 4 top priorities for State Department of Health have not changed from one commissioner to the next. Unfortunately, they remain things like the opioid epidemic, infant mortality, obesity, and smoking. And Dr. Adams, who is my he faced these same issues going forward, and so that's what we're going to talk a little bit about today. Next slide. Oh, sorry, Teresa, I took away from your notes and I didn't do that. So this just shows you drug poisoning deaths, and that's from 2004 to 2016. And what I want you to notice here is that this is a rate. So Indiana's rate of drug poisoning deaths is higher than the United States, which is in the blue line here. Rates don't usually mean a lot to people, so what I'm going to tell you is that this equates to 72,000 Americans that lost their lives last year. 72,000 individuals lost their lives from drug overdoses, most of those being opioid poisonings, but not all of them. And in Indiana alone, 1,700. You know, we talk about those numbers and statistics and we put them on graphs, but you know, the reality is those are people. Those are our neighbors and our friends, our aunts, our uncles, our daughters, our sons. I would venture to guess if we did our stand-up routine and I said, stand up if you've been affected by the opioid epidemic or the drug epidemic in some way, I would imagine every person in here would stand up. That's usually what I see as we talk about this going forward. But we know that besides the drug overdose deaths, there are many, many more people that struggle every day with substance use disorder. And that's not just drugs. It may be alcohol. There are all kinds of substance use disorders that we don't talk about on a regular basis. Teresa, next slide, please. This shows you from 2012 to 2016 death rates. And the darker blue around the state shows you the highest incidence of those drug overdose deaths. Since 1999, we've had a 500% increase in our state. We were one of the top prescribing states for opioids, for narcotics, so consequently, we are one of the top states for opioid overdose deaths and substance use disorder associated with this. We also saw a 52% increase in just the past few years with this. Next slide. But what is important to note here is that you can see the change from 2012 to 2016, because for every life that we've lost, we've saved a lot of lives too, right? So this shows you the increase in people who had drug overdoses but did not die, fortunately, and there was about a 321% increase in that. In 2016, we had 8,300 emergency room visits across our state for drug overdoses. And if you look at it, just in the last year, from 16 to 17, we had a 35% increase. Now, a lot of my colleagues thought that was really bad. We're seeing increasing overdoses in the ER. But you know what that means? We have naloxone in the hands of the people in our community that are saving lives, right? And there's a lot of debate out there, unfortunately. If you talk to people, there are some people that wonder, why do we keep doing it? How many times? And you know, with EMS, it's hard. They go out 5 and 6 times in the same week on the same individual. And all I can say is we have to save the life in that moment if we're going to have an opportunity to save a life for a lifetime, right? So we keep doing it. We keep doing it. We don't stop doing it. Next slide. And if there's any doubt that remains, my Trauma and Injury Prevention Division keeps track of what types of injuries people die of. What you can see there is the unintentional poisoning in the bottom line, and that has increased 1,039% since 1999. So unintentional poisoning, it could be anything, but the bulk of those is opioid epidemic. Yeah, exactly. There could be other things that people, you know, a child who drinks turpentine or something like that would also be included in that. All of the children who have parents at home, or have lost a parent, or have a parent in prison because of this, a child that's been removed from the home, a child that is left in the home, that child can't win, right? We call things adverse childhood experiences, and if you're in parenting, you've probably run across that term at some point. but it means you had an experience in your past as a child, and those experiences add up, and they give you a score. And Dr. Walthall always teasingly says, too bad we all don't walk around with a bubble over our head that says what our ACE score is, right? Wouldn't we be a little more kind, loving, supportive sometimes if we knew what that individual came to? You know, the person that's in the grocery store that's checking you out and is so mean or so unkind, or the person that honks at you and tries to run you off the road. I always try to think, God, what are they dealing with at that moment? You know, what is it that I need to pray about for them? So those adverse childhood experiences, if you're left in a home where substance use disorder is occurring, it's an adverse childhood experience. If you're removed, it's an adverse childhood experience. So we know that this opioid epidemic in the state of Indiana and across our nation is developing a whole generation of children that need to be plugged into supportive care, right? They need mental health support. Next slide. I'm going to skip this, but I'm going to show you, if you ever want to know any data, if you want to get online, you can go to isdh.in.gov. You can find all kinds of information that we keep with regards to drug overdoses, that we keep with regards to naloxone, that we keep with regards to ER overdoses, and get information.
I went on that website.
Did you?
It is absolutely wonderful.
It's got all kinds of information, and it's got all kinds of resources on it.
Yes.
So if you need help, reach out. It's there. You can call me. You can email me. I'll get you to the right person if you don't find it. Next slide. It's really important that when this whole epidemic started, we kind of got caught with our pants down, quite honestly. We didn't have enough mental health people to help us out. We didn't have enough drug treatment programs, right? Because we'd ignored it. We'd ignored it in a lot of our minority population. And then it hit all of us. We all started to experience it, and we were very much in need of resources. So we've been working very hard to get inpatient and outpatient therapy programs across the state. And the goal is that by the end of 2019, you go to the next slide, please, Trace. This shows you our expanded areas of coverage. And we're trying to get an outpatient-based treatment facility within an hour of every single individual in the state of Indiana. And that's really difficult. We'll talk about that a little bit more when we talk about rural health, but 49 of our counties are rural. We have 33 counties that either have no hospital or no hospital with OB services. So when you live in Lake County, when you live in Marion County, you don't understand that aspect of it quite as well, but this is a different thing that other people face across our state. Let's move on to the next slide, please. So we'll talk a little bit about infant mortality. Yes. So really what we're doing is training a lot of paraprofessionals along with that, like mental health workers that are social workers, psychologists, because we'll never be able to train enough psychiatrists to do this. Honestly, if you look at a lot of psychiatrists' work, it is being there and making sure that people are on the right medication that they need. What we need is more medication-assisted therapy across the state. We need more family doctors, internal medicine doctors, obstetricians, to see this as a part of their normal care, right? When I went to school, I didn't learn anything about giving MAT therapy, okay? That was kind of something for the addictionologist or someone else to do. Now we're trying to get it back in the curriculum so that every family doctor and internal medicine doctor and OBGYN, pediatrician, when we finish our training, we've been trained that that's just another part of our toolkit, right? Because this is a chronic disease. It's like me getting out and not knowing how to treat blood pressure, or getting out and not knowing how to treat preeclampsia or preterm labor. It should be something that's a part of my toolbox, a part of my tool chest. And we need to understand the importance of pairing that. We'll talk a little bit more with mental health services. One thing that has been very surprising to me has been Dr. Walthall and I kind of got interested in, okay, let's look at dual diagnosis. Let's look at obesity, and let's look at mental health diagnosis. Let's look at opioid use disorder and mental health diagnosis. Let's look at preterm birth and mental health diagnosis. And it's 65% of the time there's a dual diagnosis there. And what we've been doing is we've been ignoring, overlooking, don't have the resources, one of the most important factors, one of the most important diagnoses, correct? Which is the mental health diagnosis that goes along with it. Infant mortality basically is the death of the baby before his or her first birthday. So in Indiana, our infant mortality rate is 7.5 deaths per 1,000 live births. That doesn't mean a lot to you, but what that equates to is that 623 babies did not see their first birthday in 2016 in the state of Indiana. And if you look at the last 5 years, over 3,000 babies didn't celebrate a first birthday, will never celebrate a birthday in our state. And it's when Governor Holcomb heard that, he said, you know, this is unacceptable, we have to do something. We have the 7th highest infant mortality rate in the nation, and it's been going up. So, next slide, please. Governor Holcomb said, Dr. Walthall, Dr. Box, Terry Stingdon with BCS, get to work on this. Get your team on this. Get excited about this. We're going to be the best in the Midwest by 2024. Next slide. So this is to show you. Yes, ma'am.
So there were 6 Planned Parenthood that closed in 2016. How we correlate to these numbers, and that can give you guys replace the care that we're getting from those closed clinics with rural areas.
Right. And a big discussion that I've had to have as a gynecologist with our legislators and other people is that if your goal is to close Planned Parenthood, you need to look at the number of women that are serviced through Planned Parenthood. And if you do that, you need to make sure that that service is available other places. Unplanned pregnancies, you know, my thought process is long-acting reversible contraception is a great way to do things which decrease infant mortality. It decreases unplanned pregnancies. It allows women to not face that first 20 weeks of uncertainty and ambivalence and what are they going to do. You know, it gives them an opportunity along with the young man to maybe have a reproductive health plan so that they get the education or the job training or whatever it is that they want in before they actually have their children, because we know how hard that is, right? But we'll talk about some programs that is really, really addressing that. It also, the closer we have our babies together, a lot of people don't realize that increases your risk for preterm birth. Optimal spacing is at least 18 months before you get pregnant again. So I've talked about that a lot throughout my life, but a lot of people are not aware of that. And I think that's a really important factor, and I understand where you're coming from. I just wanted to share this slide because this shows you that Indiana is truly the last in the Midwest, and you wouldn't be surprised about that. We've got our work cut out for us. But I 100% believe with the excitement and with the buy-in and the community support that we have across the state, we are going to make a difference in this, and we are really going to be able to address this in the coming years. Next slide. I always share this slide because I think that people that don't work in the space maybe don't really understand, but this shows you infant mortality based on race and ethnicity. So there's a healthy people goal for anything in life. So if you get your cholesterol checked, we know what the goal is for that to be, that or less. If you get your blood sugar checked or your hemoglobin A1C, we know what the goal is for that. The healthy people goal for infant mortality is less than or equal to 6 infant deaths per 1,000 live births. If you look at the red line, 3 out of the last 5 years, our white infant mortality rate has been at or below the healthy people goal. Now look at the blue line, that's Indiana overall. The black line is our Hispanic infant mortality. And the thing that dismays me here is it's 9 infant deaths per 1,000 live births, but it's been increasing each of the last 3 years. The green line, that's the black infant mortality rate. Over twice as high as the white infant mortality rate. What I can say about this is the good news that's not shown on this slide is it's down from 18. But what I'll show you in a minute is that Lake County has a zip code where the black infant mortality rate is 25. Okay? Well, Lynne also has one. So it's clear that whatever resources, whatever programming, whatever things we institute in the community need to be directed to these very disparate populations. And if we're not addressing that, we're not going to change this. Next slide. We do know what our babies die of. And that is, and you can't see it very well here, but the bottom, the pie chart here, the bottom is perinatal risks. 46% of our babies die from that. Really, that's related to the mom's health going into the pregnancy and the care throughout pregnancy, okay? A big factor in this is babies that are born preterm, Maybe mom broke her water early and then the baby goes on, delivers early, or gets septic infected from that. Maybe the mom just comes in and is in labor and has a baby. Maybe it's the fact that you have morbid obesity or obesity, and you have a higher incidence of high blood pressure, you have a higher incidence of diabetes, and then that leads to us having to make the choice to deliver you early to save your life and the baby's life sometimes, right? Because that can lead to severe preeclampsia or toxemia. About 22% of our babies die from congenital birth defects, and a lot of people would say, well, that's the luck of the draw, there's not much you can do. But the reality is, we can impact a lot of birth defects, right? It's about, were we taking folate, were we eating healthy beforehand, so we decrease the risk of spina bifida and neural tube defects? It's about, do we have diabetes that's out of control that increases the risk for heart defects and spina bifida and neural tube defects? Is it about, were we taking a medication that was legally prescribed that I really need for my blood pressure, but guess what, it's terrible for babies in the first trimester. Every organ in that baby is formed by the time that baby is 12 weeks. 12 weeks. So we've got to get women in the first trimester. Someone up in Allen County said to me, Dr. Box, do you really want to see them in first trimester as an obstetrician? I said, no. I want to see them preconceptually. I want to talk to them about all of this before they get pregnant. I want them to have a plan. You know, I want to look at their medicines, their habits, their caffeine, their tobacco, their drug use, their sleep patterns, their mental health, all the medications that they're on. I want to have a chance to discuss all that. So that's the ideal. Another 14% of babies are lost out of our infant mortality every year from unsafe sleep. We call it sudden unexpected infant death syndrome, but the reality is, when we look at that, about 98% of that is because babies are sleeping with an adult or another child. They get wrapped up in a sheet or a blanket, or they suffocate under a stuffed animal. You know, there's only one way for a baby to sleep: alone, on their back, in a crib. ABCs, alone on their back in a crib. We have a great program that gives away free cribs to new moms and dads, and grandmas and grandpas. And basically, it's not about cribs, right? It's about the education that goes with it. And in my experience, it's not the young adults that are having this child that I have to convince. It's grandma, it's aunties and uncles. Because you slept on your stomach and you did just fine, right? And we all know babies sleep better when you put them on their tummy, right? I get that, but they don't sleep safer. So that's what we need to continue to get that out. And we had, First Lady this year had a luncheon down in Indianapolis, and it was about infant mortality. And I think that you got to come, Laura, right? You guys were there, and Janae, and it was really about her inviting the first ladies of the church and to engage the faith-based organizations in central Indiana, some from northern. It went so well, we're gonna replicate it in northern and southern Indiana also. But it was about talking about all these factors and how we as communities need to start addressing these, how you as communities can take part in that. And after that, we had multiple churches across the state that asked, can we become a safe sleep crib educating site, whether that was through their church or whether that was through their YMCA. So we know that a lot of factors enter into a mom's health. I always tell the governor, you know, we shouldn't be surprised that we have such a high infant mortality, because a lot of nations and states consider infant mortality to be kind of a window into the health of a state. So when you look at Indiana, you have the 10th highest smoking rate in the nation. We're the 12th most obese state in the nation. We have one of the highest opioid epidemics in the nation. It wouldn't be unusual that that would be reflected in our statistics with infant mortality, correct? But that's about healthy moms make healthy babies. So it's about taking care of yourself. It's about my talking to my patients about the importance of having balance in their life, having exercise in their life, eating healthy, watching their medications, and really making sure that I take the time to query them and question them about their alcohol use or drug use. Women oftentimes will tell you the truth if you ask them. They may sit there and not tell you if you don't ask, but if you ask, they'll oftentimes share it, especially after you've been in practice for 3 years and been working with them. Next slide. So, interestingly enough, we have 13 high-risk zip codes in the state, and you'll see Lake County there at the top with the 25.8, and that zip code is 46312 if you want to know. The other one is in Allen. But I want you to notice that 7 of these are in Marion County, okay? So this isn't about not having enough care in these areas. There are plenty of hospitals and obstetrician gynecologists and family doctors vying to take care of these obstetrical patients. It's about we're missing the connection, right? It's about utilization of the care in that area and how can we connect people to care. Next slide. This shows you counties in red, which have infant mortality rates that are higher than the state's average. Counties in green, which have infant mortality rates that are lower than the state's average. And in the beige is kind of equal to what the state's average is. You'll see that we do have 4 counties, Hamilton, Porter, Johnson, and Hendricks, that did reach that healthy people goal in the 2012 to 2016 data. Next slide. So this talks a little bit about what we face in our rural areas. As I mentioned, 49 of our counties are rural, 33 of our counties have no hospital. I was just in one, Benton has no hospital at the local health department. And of those, if they have a hospital, many of them don't have obstetrical services. So it is about access to care, getting care close to home, right? Because we know that many women, maybe a 1-car family or a 0-car family, they have a job that they have to be at. It's one thing for me to run down the street or run downstairs a floor to get my obstetrical care, maybe miss a half an hour of work or 45 minutes. But if you've got to travel an hour and a half to get that care and travel an hour and a half back, you can't do that, right? You've got kids you got to get off the bus, you've got other obligations and responsibilities, so people don't get care and they just come in when they're ready to have a baby. And that's not in the best interest of mom or baby, either one. So the plan is, can I work with counties like Vigo County on the west side, or up in Lafayette County, Tippecanoe County, or even Southern Lake County, to hire an advanced practice nurse with obstetrical experience, to hire a nurse midwife that will actually go into these counties and see women closer to home. Maybe in an FQHC, it may be in a family doctor's office who's just too busy and overwhelmed to also do OB. It may be literally going to their homes. But whatever we do, we have to figure out a way to reach this population also. Next slide. This will show you our delivering hospitals on the left-hand side. You can see the large gaps of areas that don't have it. On the right-hand side, this shows you our level 3 nurseries, okay? Meaning we can take care of that higher preterm baby, that baby that's born very early, or that mom that has significant health consequences or problems that may need a higher level of care. The pink shows you a 30-minute area around that. See how many areas of our state? My goodness, the southeastern side, we're missing that totally. So it's no wonder that we rely on Cincinnati and Louisville there, and that we've got a helicopter positioned right down there in one of those counties to pick up mom and baby, to move that dyad if needed as we go forward. We know that establishing levels of care, which the governor signed into legislation, where we actually say a mom and a baby should deliver at a hospital system that is equipped with not only the personnel, but the technology and everything that is needed to manage those complications. And that was signed into legislation this summer. The governor signed it. So we're now going out and surveying hospitals and making sure, we want every hospital to be the level they want to be, right? But we want to make sure they meet a certain level in order to do that, so that we know that mom and baby are taken care of more safely. Next slide. I will say that our maternal mortality is also the 3rd highest in the nation. So we have a long way to go, but I know we're going to get there. I'm 100% confident. You know, when you look at mental health and infant mortality, people would wonder, well, you know, how do those really overlap? They overlap in a tremendous number of ways. I can tell you, women who are using substances, they're most likely to want to get help when they're pregnant or they have a newborn at home, but they're also most embarrassed and have a more stigma associated with getting help when they're pregnant. It's like it's bad enough they're doing it to themselves, right? But now they're doing it and they're pregnant. And what we have to understand is this is a chronic disease. They cannot help what they're doing to themselves right now. We have to help them. We have to reach out and give that hand. We have to find those women and wrap them with mental health care, with medication-assisted therapy, with different places to live, with support after the baby comes, because anybody in here who's had a baby, I know you know how stressful that is. I mean, I remember calling my pediatrician about 5 days into it, like crying, my baby won't latch on, I think I'm gonna explode, my breasts are so big, you know. The whole works, and I had been in obstetrics forever, you know. So we all need support. And one thing that I'll talk a little bit more about is that I was reading an article the other day about postpartum care, postpartum management, and the importance of support during that time in your community and in your home. And the thing they pointed out is that culturally, across the world, other cultures come in and take care of that mom and that baby. They feed them, they clean for them, they help with the other children. They give that mom time to really bond with that baby, breastfeed with that baby, and heal herself. And the article went on to say that we don't have that culture in the United States. Our culture is get back to work, right? Get back to normal. You know, when are you coming back? And we don't really give women that time a lot of times. Now, I can't say that I'm seeing changes in this now. I see more businesses that give more time off before delivery and more time off after. I see more women taking that 12 weeks. I say that having gone back to work after 2 weeks of having triplets and 4 weeks with my first one. Never would do that again. Never, ever would do that again. But at the time, you're young and you're driven and you're trying to develop a career, and I get that. But the reality is it kind of gives you that one little window of time to really start that connection. And so you should take it and you shouldn't feel guilty about it. And that's what we need to share with our moms. But we also need to surround them, right, with the care. Churches used to do this. Families used to do this. We need to figure out a way as communities that that support isn't there for a mom and a newborn baby for that diet. How can we do that? Perinatal depression and anxiety are very common in pregnancy. Next slide. And it oftentimes, let's talk a little bit about what we're going to do. Let's skip that slide.
Question.
Yes.
I'm actually wondering a little bit more about what you just said. I'm not familiar too much with WIC program, how it operates here in Indiana. I do have a friend who had a baby when we were like 21 and we were living in Michigan. And that WIC program supported having a nurse come into the house and checked on her regularly, helped her with like putting the baby down, breastfeeding, latching, all of that stuff, and cleaning the house and just general like concepts. Wow. And it definitely came out multiple times. Like that was what the WIC program supported there. And so I'm curious about like what does that look like here in Indiana? And like if we don't have a culture that supports that, like can we put in place like things that can do that from a more like
right.
How, yeah.
So I've never known that WIC program. I've never seen that. I've been in this for a lot of years. What I will say is that I'm wondering if they didn't have WIC connected with like a community health worker program. And we'll talk a little bit more about that because I'm going to go back a slide in just a minute. But the reality is WIC at a national level, and I just reached out to Jerome Adams, our Surgeon General, and said, you know, we have a lot of kids that are not getting lead tested. We still have a lot of kids that have too high of a lead level. And up until the age of 3, that crosses the blood-brain barrier. It decreases their cognition. It makes them have issues with behavioral, you know, ADHD, and lack of control sometimes. We have a large percentage of those kids that end up in a criminal justice system going forward. So I'm trying to pair WIC, who sees these, because people come back and they get their services from WIC, right? They get support from breastfeeding. We've paired lactation consultants there. I'm trying to pair the lead testing there, but national WIC, USDA, and lead won't play nice in the sandbox together. So I reached out to Jerome and I said, Jerome, can you help me? And I just had a conversation this week with a lady at HHS, and she says, you know what? I'm not the first person that said this. We're going to look into this. We're going to figure this out. Because wherever we get touch points with this population, we need to make sure to make the most of them, right? I want information there about safe sleep. I want to know, are you doing okay with breastfeeding? I want to know, are you in a safe atmosphere at home? Do you have food? How are you caring for your other kids? Are you going back to work? Do you have transportation? All of those things. Did you go back for your postpartum visit? So I think your point is really good, but that WIC has never existed here. And I'm wondering if the WIC there in Michigan wasn't in some way planned with a community health worker program, which is exactly where we're trying to head going forward. So it's a good question. 1 in 7 women, or 14%, will report that they have perinatal depression. A lot of times, they're not going to tell you if you don't ask them. And that's why every woman in the hospital now, oh, I'm sorry, 5 minutes?
No, we have questions.
Oh, yes, ask away.
With the lead, we also have to take into consideration with nutrition, because mothers will be eating tuna, and we've got the cross-contamination that way, because cans of tuna are easy to eat, they're quick, they're easy, they're cheap, but yet they're nursing, and so we have that barrier as well. And so nutrition is a very important part,
Right.
other than just WIC.
And what I tried to point out to them is that a lot of these babies, they all get stuck anyway to get their iron level done,
Yes.
right? And guess what? Low blood count
Yes.
and lead, high lead go together.
Yes.
So if we're sticking them anyway, let's just check the lead at the same time, right?
Yes, and also the use of plastic gasifiers, plastic nipples.
Yes, Jenny.
Question too. She had said something about culture, you had said something about culture, and I'm just curious. I like what I'm hearing from you, and a lot of what you're saying is about changing the current culture of how we do things. It's a whole community of putting our arms around new moms and making sure that they get that time to reacclimate. So I'm curious, is that an agenda of yours? Is that something that you're looking to do, is to help us figure out how to change that culture to be more mom-friendly, I guess, with new babies, as well as just healthy-friendly in general?
Right. So, in some ways, I feel like I'm trying to develop a family with community health workers, you know? But for some people, that's the family they have. So for instance, nurse-family partnerships. I don't know if you guys have nurse-family partnerships up here. I hope you use them. Very educated women about following a woman through her pregnancy and then following them beyond for the first 2 years. Right now, they only do first-time moms. We're getting them to cross over to do some of our substance use disorder moms. My goal is to change that nationally with nurse-family partnerships and say, I need you for people who have multiple children too, who this isn't their first pregnancy. But that takes time. It's a culture change for them. But they do amazing things. I just went to a graduation for NFP. And Nurse Family Partnerships had a graduation at the Children's Museum for 83 moms. They were 56% African American, 30-some% Hispanic, some white in there. But you know what? Their statistics were not just about healthy babies and moms, but they did have them. They had 83% of their moms the babies had normal birth weight or above. We had over 90% of them that delivered at term. And I never see that. I never see that in these higher risk populations. They had 99% of their moms go home breastfeeding. And the average length of time breastfeeding was 33 weeks, I think. That's incredible. That's knocking it out of the park. But you know what that is? That's wrapping that woman and her family with someone who cares. It's connecting her. It was about connecting her and her partner to further education. We had 10 people get their high school education through that period of time, another like 15 people working on it. We had 2 people finish post-education, secondary education, college education. We have multiple women and their partners go on and get further job training and certification. So it's really about addressing that mother-baby dyad as a family unit. And at this graduation, there were grandmas and grandpas and aunties and lots of men who stood up and said, I'm the father of that baby, and I'm here to take care of this baby. And then they ate cake and stripped out of their diapers and played at playsticks and had a great time. But it was the most overwhelming thing. And I sent it to Governor Holcomb because, you know, he gets to hear all the bad statistics and all the bad news. But I sent him pictures and I sent him a story. I sent him all the stats too because he's a numbers guy. But I wanted to paint him a picture of what is happening across the state and where that money that we, you know, get the legislators to actually devote to infant mortality, to nurse-family partnerships, where that's spent and how that's spent. Because that's what makes a difference. That's what legislators can get behind and do, and that's what we need to do. We were talking when you came in about storytelling. You know, legislators, they hear my statistics, they take my white sheet. What they want to hear is the stories. They want want to hear about somebody from their area. So I was up in Pulaski County about the opioid epidemic. We've got an ECHO, which trains people to actually give MAT therapy. So if you're a family doctor and you're in an underserved area or any area and you want to, or an internal medicine doctor, you want to give MAT therapy, you can get training over a computer setting through IU School of Medicine, and you can do that for 12 weeks for an hour and a half, and they will be, you can bring your cases back to them, and you'll have consultants on the phone with you and on the television with you, and you've got a resource, a specialist there. But that's the way we multiply our power across the state. And when I saw Dr. Allman, who is actually their local health officer, he said, I'm sorry I'm late. I just finished my first patient with medication-assisted therapy. He says, you know, we don't have anybody here to provide this. So I decided to become that. So those are the stories that we need to feed back, that you can give us, that we can feed back to our legislators, that can make a difference. And in 2019, I have to go in front of them and ask for money to do all these things that we'd like to do, right? So, yeah, 2 minutes? Okay. So I won't get through half of what I wanted to talk about here, but the bottom line is suicide in the postpartum period, perinatal anxiety, perinatal depression contributes significantly to our maternal mortality and our infant mortality. And the thing that we know also contributes significantly is that women who are under stress every day of their life, it's a stress to get to work, it's a stress to get your kids to school, it's a stress to wonder about your safety in your home or violence in your home, it's a stress to know whether your next meal's coming from and whether your electricity is going to get turned off. They have a higher risk for preterm birth. And even if you take all of that out and your Venus, okay, you're the tennis star, you take all of that out and you have every resource, as a black woman, you're still 3 to 4 times more likely to die in childbirth or related to childbirth, or to have a preterm birth or a complication. So there's something that's not connecting with our healthcare workers, okay? There's something that we're not understanding, that you're not communicating or we're not hearing, that we need to address. And that's why these community health workers that come from a specific community, okay, so one great program is up in St. Joseph's County. They had a very high mortality rate. They hired 6 black doulas. A doula, you know, basically is a support in pregnancy, during labor and delivery for moms, but they really have become much more than that, right? Support during pregnancy and even right after delivery. They are knocking it out of the park, so much so that they have actually expanded to several counties right here around you. And that's taking somebody from the community and actually leaving them in the community to reach those women that we know need support during pregnancy, okay? So all of what Dr. Walthaw and Terry Stington and I are working on is how can we get women connected to care? Because we know that's going to help them and help their children. So I had other stuff to talk about today, but I'm happy to answer questions about anything else you guys want to. Yes, sir.
Dr. Rock, I'm the newly appointed disease intervention specialist for the Gary Health Department.
Welcome.
So you know, Dr. Rutland's agenda is reducing hypertension in the African American community,
Yes.
heart disease, diabetes. That is a mammoth task. And it's not just unlike people think, oh, well, you know, they don't know how to eat well or their genetic factors and things like that. That's also part of it. But you know, there's food insecurity in our area. You know, there's a cost barrier. I mean, I experienced it last time. I'm like, okay, I got $10. I can get $1 made chicken, or I can spend $8 on a salad. No, we need to make sure these are just issues that we're facing right now, trying to make a healthier Gary and a healthier Northwest Indiana. Are there any programs, funding that the state has to support programs like that in our area?
So I love your Dr. Rutland, by the way.
I love
him.
him.
He is so fired up. He is on fire to help you guys out. And I'm sorry you guys didn't get that grant that we applied for up there. Well, congratulations. You did a great job on it. And I know Dr. King was very impressed. She's the Marion County Health Officer. So a big part of what we're doing with our intake of women, pregnant women across the state, and with every Medicaid patient is to actually look at social determinants of health, right? Because what we're finding is that having high blood pressure is a risk factor, having obesity is a risk factor, smoking is a risk factor. But one of the biggest risk factors is where you live, your food security, the lack of violence, the lack of stress, the support you have. So yes, we are trying to address all those things, and through our community health worker program to understand what resources a community has and what resources a community needs. So for instance, east side of Indianapolis, 7 of those zip codes that I showed you are on the east side of Indianapolis, Marion County, right where I practiced for the last 30 years, okay? So what we did, community hospitals gathered together faith-based organizations, businesses, not-for-profits, every hospital, all 5 major hospitals that did deliveries from that area, and we had a huge infant mortality summit. 250 people came. We talked about everything that contributes to infant mortality and maternal mortality and how we were going to start chipping away at that and picking away at that. I went to the Bonner Center on the east side of town. They had great resources. They're getting apartments for people that are low-income apartments. They're trying to develop, what we're trying to do is put Medicaid services to sign up for Medicaid where there's a food pantry, right? How about we go to where the population is that needs this and do this? So what I'm going to say is the state is not going to solve this for everyone, but the state can come in alongside and can join with grants and other things as communities start working in this space and identifying needs. But a big part of what I find as I go around the state is that so many areas don't know everybody that's working in that space. So sometimes it's about getting a convener in your area. If I need to be that convener, I'll come back and do that. But that person that can actually get everybody to the table, and we can talk about every resource that's available within these zip codes, and how are we going to tie that together. And that's what that community health worker, that nurse-family partnerships, that's paramedicine, maybe in our rural areas, they need to know those resources, right? And we need to know where we can get help for people. Because there is help out there, but we don't do a very good job a lot of times of connecting people. 211 beds, I should have mentioned, quite honestly. If you have someone who's decided, I've had it, I just overdosed, I'm ready to get help, I'm ready to do something right now, if you need to, you can call 211. If they're in the emergency room, they can call 211. We can find the nearest open bed for you to get that person in, or the nearest outpatient treatment. Right then, right there, 2 o'clock in the morning, 3 o'clock in the morning, wherever it is, whenever it is. Because you know when people decide, that's when we need to be there. That's when we need to come alongside and say, yay, we've been waiting for this moment. Now here's what we're going to do. They can tell you where the nearest bed is to you. Now, the problem I have is in Marion County, a lot of people don't want to leave Marion County, right? They don't want to leave Lake County. And if you have the same problem here, which I'm sure you probably do, we have a limitation, you know? Fresh start for women that are pregnant with substance use disorder, and I didn't really even get to that part of my talk, but we have a program that will take a woman with an open DCS case who's pregnant with up to 2 of her children under the age of 5, or even if she doesn't have an open DCS case, if they're interested in getting help for their substance use disorder, they can come and bring those children with them. We'll get them MAT therapy, we'll get them parenting classes, nutrition classes, we'll get them prepared and ready to go back to a different living environment. We'll get them help to get further education or further job training, make sure they're connected with that obstetrical care that also has the mental health services that they need. And then when they transition after delivery off to the family doctor or the social mental health worker, whoever it is that will continue that MAT therapy with them. But that's, you know, we have one in Marion County, we have one in Winchester, we're opening one in Columbus and one in Evansville. I'm sure you guys need one up here. I have no doubts you need one up here. So the problem is what we need to do, and I, you know, they were worried about, what if we build all these places and then the, you know, opioid epidemic goes away? And I said, you are always going to have women that need to get out of their homes because there's violence. You are always going to have homeless people that need help, that need a hand up or help up. So these homes, these places that we develop will never, I think, be empty. We just have to figure the resources to get them there. Somebody else had a question. Oh, yes, I'm sorry. Yes. Right. Right. And that's an excellent point. Okay, so the whole school violence thing, what we tried to help Governor Holcomb and the team see when they asked us to get together and decide what we're going to do about school violence was, yes, there's school violence where people come in with guns like they did in Noblesville. Like my deputy commissioner, called me this morning on the way up and said, my kids are home from school today because a kid at their school posted a picture of himself with a gun and said he was coming in to shoot the school up. What do you say to your kids when you go home, right? What do you say to your kids? And she said her niece had been out last week because there was a bomb threat in school. So kids don't feel safe going to school, but the reality is we tried to tell them that there's a lot more violence in schools than just that. There's bullying. Indiana has one of the highest sexual assault rates of young women and men in schools. We have one of the highest suicide rates in the nation in our schools. So there's a lot of violence, and it all stems from what happens back here, way back. So we have to get way back at the beginning, in elementary school. And so that's exactly what we did. We said to the governor, and we have said at the table now with the Department of Education multiple times to say, and what I heard from the Noblesville parents and from a teacher who was a Noblesville parent, the teacher said, Dr. Box, if you don't address this, what you don't understand is even if that kid doesn't come in and is violent in school, they come in with a look on their face, they're not going to learn anything that day. Even if they don't disrupt my classroom, they're not a single thing is getting through. We have a system right now where DCS can come in and take a child out of a home, and the next day that child gets up and goes to school with a different backpack on a different bus to a different situation, and the teachers don't know it because we don't share information, because that's a violation. FERPA, HIPAA, I can't tell you the number of things. So we have to figure out a way through that. We applied for and got several grants this year to actually put into effect some YRBS testing, youth-based risk assessment testing, to determine where children are in the state, to give every school system feedback to where their kids are, how much of an issue this is. And then there's a behavioral health screen that we're going to make available to schools if they want to do it, so that you could test every one of your kids and you could know. I mean, some of your kids, you obviously know that, right? Who needs help? Other kids fly under the radar. You have no idea what they're dealing with. But the reality is, the whole plan is to make sure that every school is paired with a mental health worker. A lot of schools, that mental health worker is in the school. And I heard a story. I heard a young lady tell a story about the fact that she was getting ready to leave her junior high school, walk out the door, and kill herself. She was on her way out the door, and she passed the new office that they had opened that had a mental health social worker in it. And she thought, well, maybe I'll stop in. Maybe I'll just talk to somebody. And she did, and that little girl is 16 years old right now, doing great in school. But we could have lost that kid. So yeah, the resources have to be there, and that's exactly what we're talking about with the governor, because we believe the only way to address the violence and all the other stuff that's going on in schools right now is to get down here and work with social emotional learning, but to help these children that we know have so many adverse childhood experiences. You understand?
Thank you, Dr.
he knifed me. That Daniel Cottage, where we were standing at that moment, would no longer be his home. That the boys in the hallway behind him who were fizzing with nerves because Fred might knife me, and there was one kid who actually said, "Fred, my man, gonna cut staff to the bone." Those kids wouldn't be his friends anymore. I wouldn't be there to help him. The police would come, drag him off to juvenile hall, lock him up. But all I saw was the blink. And somehow I knew this was my shot. So I said to him, "Fred, just make it easy on yourself and hand me the knife." And I was scared to death he was going to bring that knife down and chop my hand. At the same time, I knew I had to keep my hand out there. I had to let Fred know I thought he was a good kid and give him a chance to act like one. I can't tell you how long I stood there sweating through everything I had on. Until Fred finally sighed and handed me the knife. I remember taking that knife and turning to this locked cabinet behind me, locking it up, and then just leaning my head against the wood on the cabinet and taking a deep breath. And then turning to the boys in the hallway saying, "Okay, show's over. You know, find something to do or I'll find something for you." And there's nothing like telling teenage boys you would find something for them to do that makes them go away. So I turned to Fred, this kid who 2 minutes ago had me terrified. And I look at him and I see there he is in his raggy jean cutoffs, dirty red t-shirt, clothes just hanging off of here, plastered to the side of his head. And I said, "Fred, sit down before you fall down. Tell me what's going on." And I knew Fred's story. I knew his mother was a schizophrenic. And he said, "I ran away so I could go home and be with my mom. And every time I sit there watching the TV, she'd tell me, 'Get your butt outside, go play.' I'd be outside playing, she'd say, 'Once you do, get your butt back inside the house. There ain't nothing I can do to please this woman.'" And I thought, yup, and there I was saying, "Fred, go to intake." I was another adult looking right through this kid, telling him what to do, and not paying any attention to him. And he said, "And I found the knife in the hall closet, and I took it so my mom couldn't use it on me. And I also had it there in case she came at me to protect myself." And I thought, what a life this kid's living. How can I fault him for this? And it was about this time that the unit supervisor came up. And I sent Fred to his room, told the unit supervisor what was going on. He said, "We gotta bounce him. We can't have kids bringing weapons in here and threatening staff people." And I said, "No, you can't. He trusted me. He gave me the knife. He's a good kid. You gotta keep him." And we kept Fred. And Fred made it through the program. And he didn't end up in jail or on the street or dead. But I gotta tell you, that's become the litmus test for my job. As long as nobody pulls a machete on me, I'm having a good day. So now you've heard a story. And let's talk about what you've heard. What kinds of things did you think about me as you heard the story? What kinds of qualities did this bring up for you? How would you analyze who I was in that moment? Just shout it out, because we're here to interact today. Scared, right. Terrified. Brave. Caregiver. Authoritarian, yeah, and not in the right way too. Quick thinker. Right, so if I stood up here and said to you, I can be authoritative, I can be a quick thinker, I can be frightened, I can be a caregiver, maybe you'd believe me and maybe you wouldn't. But the scoop is, I told you a story, and those are the conclusions that you drew about who I am. Much more powerful than if I give you a list of qualities about me, right? This is the beauty of storytelling. You show people rather than tell them. You let them draw their conclusions from what you share, and you actually connect with them. Could you see the knife? Yeah. Were you frightened by it? Yeah. Because that's what happens with a good story. I'm a neuroscience nerd, so I study how the brain works. And one of the things we know about storytelling and why they work is, for example, when I'm telling you that story about Fred and the knife, and I get to that machete, the fear center in my brain lights up as though this thing is actually happening to me now. Because your brain can't tell the difference between something you're imagining and something you're actually going through. Now this is interesting, but what's cool is that the fear center in all of your brains lit up too, as though you were actually experiencing this. I was telling a story, this became your experience too. Which means that your brain and my brain were in sync in that moment. And when that happens, what goes on is that you are more likely to believe anything I will tell you, because our brains are in sync. We're both feeling the same thing. And that if you were going to resist anything I was going to say, that resistance was low in that moment because we were sharing this story, this journey. That's what's going on biologically in your brain. That's the power of storytelling. Your brain and my brain are on the same wavelength. And this is something that you can carry into your world. Because our brains are literally wired for stories. So 100,000 years ago, our ancestors were in caves, painting stories on the wall. 27,000 years ago, we were telling stories to each other as a way to share knowledge. 3,000 years ago, we created text to share stories. And 30 years ago, we created PowerPoint. So there you go. So instead of sharing words, when we tell stories, we share experiences. And we get other people's brains to light up in sync with our brains. Because here's something else that's really cool. You have literally 3 brains. The first brain you have is called the survival brain. And here you got 3 choices. You got fight, flight, or freeze. Sitting on top of that is your emotional brain. And here you have 5 brains. Mad, sad, glad, hurt, and afraid, and all the permutations in between. Also in your emotional brain is where you make decisions. We all think we make decisions in the third part of our brain, the human, logical, planning part of our brain. We are full of crap. We make decisions in our emotional brain, and then we come up with all the kinds of reasons why we made that decision. But we make it emotionally. And how do we know this? Because they've done studies with people who have injured emotional brains. If I were to stand up here with a red pen and a blue pen, and you had an injured emotional brain, and I said to you, which pen do you want, red or blue? You would not be able to choose. So people decide emotionally, and then they back and fill with logic. And stories appeal to the emotional part of the brain. So you're bypassing all of the resistance that's going on in somebody's human brain. You're speaking to them where they decide. That's why you want to use more stories. You know, and when Dr. Chris was talking about the young girl who was about to head out the door of school and going to go kill herself, and stopped at the office and got help and lived, we were all like, oh gosh, that's great. Even a simple story like that appealed to us. So imagine the power of story once you harness it. And gosh knows, it works just as well at home as it does at work. So let's talk about one of the best ideas I've come across in all of the years I've been in communication. It is called the persuasion cycle. It is the steps everybody's brain goes through before they can say yes. And here's the scoop. It was developed by a guy by the name of Dr. Mark Goulston, who, among other things, does hostage negotiation consulting for federal agencies. And he started paying attention to what process do people go through from standing on the ledge and ready to jump off to walking safely off the ledge. And he categorized all this stuff for us. And here it is. Let me read it to you because it could be hard to see. Up at the top, you will see resisting. And then listening, considering, willing to do, doing, glad to do, and for a lot of us, willing to do some more. Everybody will resist you. Why? Because their brains are biologically set to do this. Back in the old days in the jungle, our brains had one job. And that job was to keep us alive. Which meant that we were constantly scanning the horizon looking for physical and verbal risks and threats, and our brain's job was to get us out of the way. Anytime, how many of you go to work and make suggestions? Right, to your boss, to your coworkers. Every time you make a suggestion to anybody at work, or anytime you go home, make a suggestion to your teenager or your spouse, part of their brain is going, if I do this, am I going to get in trouble? Is this going to kill me? Even people who want to agree with us will resist us. So, knowing that, let's just take a collective deep breath. Inhale. People will resist you. It's got nothing to do with you. It's just how their brain works. Which means our first job is to move them from resisting to listening. And let me give you one neuroscience nerd tip on this. How many of you are like today? You come to a networking event, or you're in a room with a lot of people you don't know. Okay. Have you ever, or a family event where there are family members you don't know. Have you ever had somebody introduce herself to you and then 1 minute later you cannot for the life of you remember her name? Yes. Yes. And then your friend comes over and expects you to introduce this person whose name you've forgotten. Okay, here's how to make sure that never happens to you again. Little brain science for you. The first 7 seconds when you meet a new person, your brain is overwhelmed with information. What color is their hair? What color are their eyes? What clothes are they wearing? How do they sound when they speak? You cannot shove more information into your brain in that first 7 seconds, which is usually when we're introducing ourselves, right? Or asking other people their names. Plus, names have no inherent meaning in our brains, unless we already know somebody who has that name. So, for example, I'm standing out here in blue. Blue has an inherent meaning in your brain. If my name were Norma and you've never met a Norma before in your life, your brain has trouble processing that. So what you're going to do, the next time you're at some big event, instead of saying, hi, my name is, and introducing yourself and getting that person's name and then forgetting it, you're going to do a little idle chit-chat. You're going to do, gee, can you believe it snowed today? I did not expect it to snow. Or is this the first time you've ever been to the Avalon? Nice place. You'll make a comment or ask a question, and the person will respond. And that'll take about 7 seconds. And it's after that point that you can introduce yourself and you can ask that person's name. Because your brain has now settled down. And then you repeat their name a couple of times, looking them in the face. That just increases the chances that you will remember the name now. And not go through that tap dancing of not wanting to let them know that you've already forgotten their name. I say make your life easier. But here's the thing about the persuasion cycle. One of the things that is the most powerful word in all of our brains is our name. So now you know how to remember somebody's name. You can already be more persuasive when you're recognizing who they are and saying their name. The next thing about this is that you want to listen first. You want them to listen to you, you listen to them first. Because what ends up happening there is 2 wonderful things. First, you get data on them. They will tell you about the things that are important to them, or the things that they care about, or a little bit about their lives. Because you're going to deal with a person who is an engineer much differently than you'll deal with a person who's a high school teacher. You adjust your style and the information that you share. So they'll give you information to tell you how it is that they want to interact with you. The second wonderful thing that happens is something called the rule of reciprocity, which means that if you're asking and you're listening intently to what they have to say, sooner or later this person is going to realize, I've been talking a lot, and she's been listening nicely, and it's now my turn to listen to her. And in this instance, you've built up goodwill. And when it's your turn to speak, people will actually be interested in what you have to say. And that's when you can tell them a good story. Does this stuff make sense? Say yes. Yes. Okay. So, who has already learned something? All right. So what I'm going to do is I'm going to pass the hat. Not for money, but if you put money in, I'm not giving it back. I brought a copy of my book, Getting Others to Do What You Want. And I'm going to raffle it off. Here's why you would want this book. It's got the good stuff that we're talking about today, plus all kinds of different ways to make it persuasive. And I say, even though it's a slim volume, when you win it, do not read it from cover to cover. I say, pick up the table of contents and see what interests you there. So maybe, okay, get your brain back. That sounds interesting. And then you flip to the end of that chapter, and you will see a one-page summary about all the good stuff that happens in that chapter. So read the one-page summary. And if you still are interested, then read the chapter, and then after that, there are actually exercises in the back. Because how many of you have read a good book and thought, this is great, and then never done anything with the information you've read? Right. Because information means nothing unless you make it meaningful to yourself. So there are exercises in this book to help you make the information yours and increase the chances that you will actually do something about it. All right. So I'll pass the hat. Drop your name, your business card in there, or your name and your email address. And that will get you into the raffle. But here's the other great thing. I will email to you an outline of all the good stuff I'm covering today, so you don't have to take notes, and you don't have to take pictures of the slides, because it will just come to you. And on top of that, you'll get access to a newsletter that I do every week on neuroscience, business communication, and humor. And one week it's a written article, the next week it's a 3-minute videotape. So I'll pass the hat. And we'll start here because the microphone can reach this way. And now we'll get on to other stuff. Here is a pie chart that freaks me out every time I see it. It is literally how we get information when we're hanging out with other people. And in this instance, you see that little small green wedge up at the top, that's 7%. 7% of the information we get from other people is from the words that they use. Only 7%. The next big slice, 33%, is from our voice tone and quality, how we sound. And then 55% of the information people get from us when we're together is from our body language. I remember seeing this thing for the first time and thinking, that can't be right. Words are only 7%. But I realized if I stood up here and said, I'm really excited to be here. Yeah, you wouldn't buy it, right? Because when the body language and the words don't match, we believe the body language every time. Because we know people can be schooled on words, but most of us aren't paying a whole lot of attention to what our bodies do. So knowing that, how would you like to learn how to read people's body language to read their minds? Say yes. Yes. Yes, okay. In order to do this, I'm going to need a body language volunteer. Please, come on up. Give a round of applause. Because we need help with this stuff.
You guys should pay me, I'm sorry.
And your name is? Rose. That's right, Miss Rose. Thank you for remembering. Thanks for volunteering, Rose. All right. 75% of the people in the world. Rose is a looker. What this means is that Rose's brain thinks in pictures and images. And she's about to show us the body language of a looker. So come stand next to me, Rose, and I'll describe how lookers look, and you just show them, right? Okay, so first thing, lookers have good posture, as Rose does, because appearance is important to them. Lookers are also dressed well.
I have your salad and stuff on the table. Oh.
Again, appearance is important. Lookers also have a tendency to look up, because people look up when they are remembering something they have seen, and because she thinks in pictures and images, she looks up a lot, which unfortunately, Rose, gives you wrinkles in your forehead. Next thing about lookers is that they generally store a little stress in their shoulders, so much of their shoulders will work. And then, lookers also generally have thin lips, suck them in. Yeah, that's a chicken and an egg thing. We don't know why, but most lookers have thin lips. And the other thing about lookers is that they give you lots of eye contact. Look at them. Look at every single person in here. Lookers give you lots of eye contact. Thanks, Rose. Give a round of applause. You're done. Thank you. Okay, lookers. 75% of the people in the world think in pictures and images. You want to appeal to these people, you do two things. The first thing, you give them lots of eye contact back, because they literally believe if you are not looking at them, you are ignoring them. The second thing you do to build rapport with lookers is you use visual words. I see what you mean, or picture this, or imagine that. Those are the kinds of words that lookers use in their brain, so you are speaking to them in the language that they like. Lookers, 75% of the people in the world, they think in pictures and images. Okay, so who's going to be our next body language model? Because you saw Rose did not die. And she's up. Please, come on up, Claudette. Give her a round of applause. Because Claudette now is going to show for you, she represents 20% of the people in the world. And 20% of the people in the world are listeners. They think in words and sounds. They think in words and sounds. And Claudette's going to show you the body language of a listener. So first, listeners, usually not as well dressed as lookers because appearance isn't as important to them. Sorry, Claudette. Next thing, listeners have a tendency to look down and to the left, because that is where you look when you are remembering something you have heard. But you'll notice, when Claudette's looking down to the left, her ear is pointed at you. Because that's how she gets information. She uses her ear the way lookers use their eyes. Next thing about listeners is that these are the people who are usually clicking their pens or drumming their fingers on the table. So drum your fingers on the imaginary table. There you go. Another thing about listeners is that these are the people you get in their car and they turn over the ignition and the radio blares out at you. So this is listeners. 20% of the people in the world, they think in words and sounds. So think about that. Thank you. Give a round of applause. You want to appeal to a listener, you do two things. First, you do not give them lots of eye contact because it freaks them out. So when you're talking with a listener, you look at them and then you look away. When they're talking to you, you look at them and then you look away. The next thing about listeners is that you use auditory words. That sounds good to me. I want to hear what you have to say about this. Because once again, those are the kinds of words that are going on in their brain. You're speaking in a language that they understand. Listeners, 20% of the people in the world, these people think in words and sounds. So let me tell you the best listener story I've got. I used to meet with this corporate controller. He would sit across the desk from me and he was always looking down. And occasionally he'd look up and then look down somewhere. And at first I thought, well, he's a controller, he's into numbers. Numbers give him comfort. And then, the more I met with him, I thought, well, you know, the guy's just socially inept, and he doesn't know how to look at me. And then finally, because I was young and stupid, I thought, every time he looks up, he's looking at my chest, and I'm offended. And there was one meeting where excuse me, I'm up here. Look me in the eyes. You know, how judgmental and how totally wrong. The guy was a listener. He was never going to look at me. I didn't know that, which made me become judgmental. All right, third type of body language. Third type of way we process information. Who's going to be my final body language model? Okay, right here. Give her a round of applause. I love it when people volunteer. And you are? Kativia, thank you so much. Okay. She. Oops. Let's get you right. Is a toucher. Now what you think? That's there. Perfect, perfect. Because touchers, 5% of the people in the world. These people think in feelings and tactily. In feelings and tactily. And Katisha's already just shown you the first thing they do. Touchers, whether or not they've ever met you before in their life, they're willing to hug you. Other tells on touchers, although that's the biggest one, is that they also dress for comfort rather than style. Because once again, appearance isn't as important to them as it is to lookers. Touchers also have a tendency to look down when they're thinking about, when they're remembering something they have felt, or a tactile experience they've had. In addition, touchers also usually have full lips, usually lips. And touchers also have a tendency to lean in. And it's not that they're trying to invade your space. They are literally trying to decrease the amount of space between you and them, because that builds rapport. And then, finally, touchers also have a tendency to touch you on the arm in conversation, or just reach out. Once again, decrease the physical space. Thank you so much, Keisha. Give a round of applause. Okay. Now you know how people process information. Oh, by the way, when you're trying to build rapport with touchers, you do two things. First, if you feel comfortable, let them touch you appropriately. Let's not end up in sexual harassment court. But it could be that you've never met Tisha before, and she's coming at you with a giant bear hug, and you don't feel comfortable. And most of us, because I grew up with this big Germanic family in Minnesota, so I can say things like Yash or you betcha. And you try to hug any of my relatives, and they go, and if we're trying to build rapport with people, that's not going to do it. So if a toucher is coming at you and you don't feel comfortable being hugged or embraced, stick out your hand. Give them a point of physical contact. That's what they're looking for. So do something that feels comfortable for you. The other thing about touchers is you use language that has a feeling or a tactile component. So I want to get in touch with you to have a conversation about this. Or how is this making you feel? That's the kind of language, once again, that's going on in the brain of a toucher. 5% of the people in the world. So that said, I can read your mind now, and you're probably thinking, so which one of these things am I? Let's figure it out. What I want you to do is close your eyes. So close your eyes and remember an important event in your life. It could be that it was your 16th birthday. It could be that you got married or you had your first child. Sure as heck it wasn't the drive here. So now as you're remembering that event, pay attention to how you're remembering it. Are you seeing it like a movie, like a series of pictures and images? Are you remembering what people said, or are you describing it to yourself? Or are you remembering how you felt or how things felt to you? Okay, open up your eyes. How many of you remembered it like a movie? Right, most of you. How many of you were describing it to yourself, remembering what people said? Right, so those are my listeners. How many of you are remembering how you felt or how things felt to you? Okay, so those are my touchers. That's the good news. Now you know who you are. Here's the bad news. You're going to treat everybody as though they're the same as you. Which, if you're sitting across from a corporate controller, is not going to do you great. Here's what you can do. Your brain will always think this way, because you got three choices. Looker, listener, toucher. Your brain actually works in all three ways, which is the good news too. You have a dominant style here, just the way you have a dominant hand. But you have access to the other three styles. So for you, you'll be glad to know that there are things called, in your brain, called mirror neurons, as in mirror on the wall. This is a part of your brain that looks at how everybody else is in the space around you, and then prompts you to have the same kind of body language as them. So have you ever been in a meeting where you notice that somebody's kind of leaning back with their arms crossed and you realize that your arms are crossed too? That's your mirror neurons. Because back in the old days when we were in tribes, you did not want to have body language that was so totally different from everybody else that they left you behind. You kind of wanted to fit in. So I say let your brain do its job. You can't change how your brain works, but you can adjust your body language to build rapport with the people around you, to make that easier. Because you do have access to these other parts of your brain that have the same style as they do. You've been hanging around me for a while now. Given what we just talked about, lookers, listeners, touchers, what would you think I am? A looker. Looker. I'm actually a listener. Once again, I can't, but if I stood up here and gave the entire presentation looking down to my left, you'd be bored. And you'd feel ignored. So what I've learned to do, I can't change the way I think, but I can change and adjust my body language to make it more inviting for the rest of the world. And for you too now, how many of you stand up and give presentations at work or other spots? Now you know 75% of the people in the world are lookers, which means that a lot of the language you use in your presentation should be visual. But don't forget to throw a bone to those listeners, into those touchers, and use the language that they're using in their brains too, to include people. You can't change who you are, and don't try to. But you can be more accommodating to the people that you're with, to make them feel included, and to build rapport with them. And by the way, this stuff works even if you aren't in the presence of somebody. You can figure out who they are. Want to know how? Say yes. All right. When you're on the phone, listen to the language somebody else is using. Lookers will use more visual language. Listeners will use more auditory language, and touchers will use more feeling and tactile language. Same thing. You don't even have to be on the phone with them. You can read their emails. As a matter of fact, go back and read your emails. And you will notice, if you're a looker, you're using more visual language. If you're a listener, you're using more auditory language. And if you're a toucher, you're using more feeling and tactile language. So is everybody around you. You don't even have to be in their presence to be able to figure out who they are and then communicate with them in a way that builds a bond, that builds rapport faster. Does that make sense? Yeah. So for you, it becomes another tool you can use to connect with people. And once again, this stuff works just as well at home as it does in the office. So figure out, everybody else who's living with you, figure out who they are. And this becomes your secret weapon on how to connect with them. Share information in a way that people like to get it. Because that increases the chances. Because here's what I think about persuasion, by the way. A lot of us have a negative perception of what persuasion is. We think it's manipulative or controlling or people trying to trick you into doing something that you don't want to do. Here's what I believe. That you have a gift. By virtue of your background, your experience, your education, how you grew up. Even if there were another person sitting in this room who did the exact same job that you have, that person can't do things the way you do. This is your gift, to give to the world. But with your gift comes a responsibility. You have to present your information in a way that people can see it, hear it, and feel it. And that's what all this stuff is about. When you know you're with a looker, then you give that person more eye contact. And you don't get disturbed when listeners don't give you lots of eye contact back. This stuff just helps you connect with other people wherever you are. It becomes another tool in being persuasive, because it's your job to present your uniqueness in a way that the other people in the world can see it, hear it, and feel it. And then make a good decision about whether or not what you're suggesting is what they want to do. And there will be times when, yes indeed, so you can get those people to say yes faster. There will be other times when it's not a good idea for them, for one reason or another. And the scoop is, you want them to say no. And you want them to say no faster, so that you're not chasing them around. Because you want to release them, and then move on to the next person who can say yes to the gifts that you have. And you can do this by presenting information in a way that they can more likely get it. That work for you guys? Say yes. Okay. All right, storytelling. There are actually 6 different types of stories you can tell strategically. And here's the scoop. We all tell stories all the time. But most of the time, we do it for the wrong reason. We do it because we want people to laugh with us, or commiserate with us, or diss on some group of people or some person that we don't like in that particular moment. But if you want to be more influential in the world, you saw the power of the story I told about Fred. And you remember the story that Dr. Chris told about the girl leaving school. Already, you get, stories are more memorable. Here are stories that you can tell strategically because you have a reason to tell them. So instead of just tossing in a story, from now on, you're going to be thinking in advance about the different types of stories you can tell. What stories do people need to hear from you? And then start developing those stories. So you have this portfolio of stories to share. And when somebody says something to you, part of your subconscious mind goes, oh, I need to tell that story. Because that will be helpful to them in this moment. Oh, and by the way, more neuroscience nerd stuff. Your conscious mind can process between 10 and 50 bits of information per second. Your subconscious mind can process more than 14 million bits of information per second. So for example, right now, your subconscious mind knows how your butt feels in the chair. 5 seconds ago, you weren't paying attention to how your butt felt in the chair because your unconscious mind didn't know that was important. But when you tell your subconscious mind something is important, it lets stuff bubble up. And this is what will happen for you with storytelling. You'll have this collection of stories, and somebody will say something, and they say, oh, here's a great time for a who I am story. So let's talk about the different types of stories you can tell. So you can start building that portfolio to be more influential yourself. The first type of story is a who I am story. And you tell a who I am story to show that you have a personal flaw which makes you more human and approachable. So I stood up here in a nice dress and a pair of shoes, and you might have thought, well, she's some professional, whatever, what hardships she ever had in her life, and then I told you a story about how I almost got knifed because I was so busy focusing on myself rather than the kid with the knife, that he was willing to kill me to get my attention. So that was my flaw, which makes me a human being. You tell who I am stories to reveal a flaw about yourself, which makes you human and approachable. So that's one type of story you tell. Oh, by the way, these 6 different types of stories, they were designed by a woman named Annette Simmons, who wrote a book called Whoever Tells the Best Story Wins. Don't read that book. Her ideas are great, the book is boring. So I'm giving you the best of it right here. But the idea is, instead of, to have a purpose behind telling stories. Because that way you tell stories that people actually want to listen to. So if you're in a situation where you see people are reticent or are reserved about you or have some concerns about you because they don't know you well yet, who I am stories. Perfect. You say, here's where I messed up. And here's what I learned about it. And that makes you more human and approachable and, and relatable, and people will want to hang out with you then. Next type of story is the why I'm here story. And you tell why I'm here stories to let people know that you don't have a hidden agenda and you're actually here to work with them. And once again, when I say work, it's also home stuff. So I'll tell you why I'm here story. I was asked to give a 15-minute keynote at the Chicago Math and Science Academy on, they gave me the subject, the power of resume. All right, so how many of you are already snoozing? Right, me too. And I'm giving it to a bunch of high school seniors who would, who are snoozing already, who are snoozing anyway. And I thought, what can I say to these kids that will get them to pay attention to this and help them? Because it was the evening, I was kind of the kickoff speaker, and for the rest of the evening they were going to be working on their resumes. And so I stood up in front of them and said, if you ask any of the adults who are here this evening what they think about writing their own resumes, and if we're being honest, all of us, if we're being honest, we would get a look on our face like a cat popping up a fur ball. None of us want to do our resumes. But we also know that it's really important if we're looking for a job. So let's take a different look at resumes. And I asked them, shout out your favorite superhero. So I'll ask you guys, shout out your favorite superhero. Who's your favorite superhero?
Wonder Woman.
Wonder Woman. Thor, good. So I have all these high school kids were shouting out their favorite superheroes. Yeah, Wonder Woman ranks high for me too. And I said, okay. So who's your favorite superhero? Good answer, an even better answer would be you. That you're your favorite superhero. Because chances are you've got a talent or a skill that you do better than anybody else. Anybody else you know. And your friends, and your family. So here's the scoop. Your resume, let's take a different look at it. Let's reframe. Your resume is actually a one-page graphic novel where you get to tell the story of your superpower. So somebody who reads it could realize how lucky they'd be if you came to work with them. And then they had renewed energy about going off and doing their resume. Because they thought I was going to be some boring old white chick who was going to tell them about the power of resume. And instead, what I showed them is that I understood what it was that was of interest to them and gave them a new way of looking at something. So the why I'm here story was, I'm here to be able to give you a boost before you go off and do hard work. So that reframed how they looked at me. And fortunately, it works, thank goodness. So you know who your audience is, you know what their preconceived notions may be about you, and you tell them a story, just the way I told you this one, on how to deal with it. So that's the second time the strategic story, the why I'm here story. You tell this to people to explain to them why you're here and that you don't have a hidden agenda. Then we have teaching stories. So teaching stories involve sharing an idea in a memorable way. How many of you as kids heard the boy who cried wolf story? Right, and you remember it. It's the boy sitting on the hillside with the sheep, the teenage boy, and now that we know something about neuroscience, we realize that all teenage boys, they only are operating on half a brain on a good day. So, he sits on the side of this hill, the sheep are there, he's bored, there are no video games, and he decides, well, I'll just run down to the village and tell everybody there's a wolf and get them all to run up here. And that's exactly what he did, and they ran up and there was no wolf, and it was ha ha ha, foolga. And because he's a teenage boy, you guessed it, he did it again. And they came up the second time, and then they were really peeved. Then, of course, the third time, the wolf shows up. And nobody comes, because he's lied to them twice. And we tell this story to our kids to remind them that if you lie to me, and I can't tell the difference between what's a lie and what's a truth, then I can't keep you safe. So the power of that story, after all these years, because I'm sure most of us, even the younger ones here, heard it more than 10 years ago. It's a story we wrap a lesson in a memorable way so people can recall it years later. So that's a teaching story, to share an important idea in a memorable way. Then we have the vision story. And we use vision stories to inspire people and show them why we're working together. So a vision story, I'm going to give you a job. You are now the leader of a crisis response team, and you are about to take your people down to South America where there's been an earthquake. And you want to get down there and you want to help people. And you're sitting in the airport with your team, and your flight gets delayed, and your flight gets delayed, and your flight gets delayed. And you're looking at your team, and you can see the anxiety level rising. They want to get on this plane, they want to get down there, they want to help people. And they start snapping at each other, they start snapping at the gate agents, and they're snarky with all the other people at the gate who are feeling snarky too. So you pull them together, and you say, our mission is to make the world a better place. And most of the time we do that by going to crisis-torn areas and helping the people there. But the scoop is, it's also our mission to make this a better place to live in, right now, in the moment. So, I invite you, because once again, snarking at the gate agents, they're not the people who are responsible for the delay on this plane. Neither is anybody else who's here. So let's make this a better place right now. So frankly, we'll have more energy once we get down to the country where we need to help people, because we haven't spent it here being nasty to each other. So vision stories. These are stories that we tell to remind people why we're working together and inspire and motivate them. Next type of story, values and action story. So these type of stories, what we do is we take an intangible idea and then show through a story what that actually means for us, or what that means here at our organization. Because if I were to say to you, I believe in integrity, you'd say, okay. But you wouldn't know what that meant, because you'd have a different definition of integrity than I would. Or organizations that say we believe in customer service. What does that mean? So if we've got an intangible big idea like that, then we need to tell a story that explains to people, this is what I mean when I say that word. And then we at least have a point of contact, and you can tell me whether or not that's the same way that you would describe it. So I'm going to give you a job, another job now, and you are the owner of a children's shoe store. And you say, we believe in customer service. And your definition of customer service is that whenever a parent comes in to buy shoes for his or her child, if the child doesn't like those shoes and won't wear them within a week after purchase, we'll take the shoes back. That's what customer service means to us here. We are so dedicated to making sure that people get the right pair of shoes for their kids. And now you understand this intangible idea of customer service. Here's how it looks here. Make sense? Yeah. Right, so we take a big, big idea and tell a small story so people understand what we mean, and then they can tell us if they agree or have something different. So that's the values in action story. Making an intangible real by telling a good story about it. And then finally, we have one of my personal favorites, which is the I know what you're thinking story. How many of you deal with people who don't off the bat want to agree with you? Right. Yeah. Once again, home, office, happens all over. And in this instance, what you do with an I know what you're thinking story is you tell them, I recognize that this is what you think is a problem. This is the barrier you think we're facing. But honestly, it's not. It's not an issue. So we show them why their objection is not something that prevents us from getting where we want to go. So let's take you back to that shoe store. And I'm going to devote you, you are now going to be a salesperson in the shoe store. And you see a mother come in with her 12-year-old daughter. And, okay, how many of you have had 12-year-olds, 12-year-old girls in your life? Okay, what's the color that's in this week? What is it? Cream? Green. Okay, so green's in this week. So, so she's looking at this green pair of shoes, and you can look at her mother who's picked up the shoes and looked at the price tag, and she's thinking, gosh, I don't want to pay this much money for a pair of green shoes when next week purple's going to be in. And as a salesperson, you say, our store has a philosophy that if for any reason your daughter won't wear these shoes within a week, you can bring them back, and we will give you a store credit toward a different pair of shoes. And it's true. We can't resell those shoes to anybody. But we believe in making sure that your child is happy with their shoes enough to do that. And frankly, in all the years we've been doing this, 2 weeks ago, somebody came in and returned a pair of shoes. No questions asked, got a different pair of shoes. So if you're worried about spending money and not having your daughter wear these shoes, not an issue. So that becomes an I know what you're thinking story. I know you're worried about spending too much money for shoes that your daughter won't wear, or whatever objection you've got with people that you work with, or with your family and friends at home. Recognize what the objection is, and explain to them why this isn't an issue. It's a really powerful tool. How many of you do new business? Right, some of you. So this is a great story for any kind of new business presentation. Once again, if you're trying to get people at the office to do something, this is a great story to show them they think this is an insurmountable barrier, but you can get beyond it because it isn't as big as they think. So those are the 6 different types of stories you can tell strategically. How am I doing on time? They've all left the room. I could go on forever. No, I won't. But here's what I do want to do. Because it's one thing to give you information, it's another thing to have you use it. What I'd like you to do, everybody stand up. Yes, she's making you stand up. Well, at least I waited until you finished lunch. So now what I want you to do is scan the room. So look at other people's faces, and I want you to find somebody you don't know at all or well, and go stand next to that person. So I want you to pick a buddy you don't know. you don't have a buddy yet, raise your hand so you can find each other. Okay, everybody got a buddy? All right. So now what I want you to do is I want you to pick an A and a B. An A, you'll be the person with the longest hair. Yeah, particularly easy for you in the picture. Yeah. Okay. So you're both going to get a job here. A, you're going to spend a minute telling B about the stuff you just learned that we talked about. So it could be that you talk about some of the, maybe it's the 7-second rule about not introducing yourself. Maybe it's that persuasion cycle, how you move people along that process to agree with you. It could be the whole body language thing, the looker, the listener, the toucher. Or it could be one or more of the stories that we've just talked about. What I want you to do is talk about an idea or two that really struck you this morning. Something that was either brand new to you or something that you learned a little bit more about. So A, you're going to do that. B, you also have a job. And your job is to listen attentively and supportingly to A. Not to interrupt, but just to listen well to what A has to say. And I'll give you a minute to do this. So A, you're going to teach B the stuff that was important to you that you just learned. Go.
Something that I learned is that when we were talking about touchers,
Okay, finish that thought. I know, let's just start talking about it. Okay. You don't want to shortchange B. Because now B gets to do the same thing. So B, you get to teach A the stuff that really resonated with you in the last hour that we've been together. And A, you get to listen attentively and supportively to B. Go. Okay, finish that thought. Okay. So now, how many of you learned something from talking to your buddy that you forgot? Right, good. Now what I want you to do is be laser focused. So B, you get to start this time, and B, I want you to pick the one thing you are going to do differently in the course of the next week because you were here this morning. And A, you get to listen attentively and supportively to B. And once again, and my overachievers know you can't have 3 things. One thing you will do in the course of the next week because you heard it today. Go. Okay, finish that thought. And now A. A, it's your turn. So you're going to tell B the one thing you're going to do differently this week because you were here. Go. Okay, finish that thought. All right. So, how you feeling about your buddy? You like your buddy? here, and a week from now, and here's the neuroscience. You will forget 80% of what you heard today. And we all make promises to ourselves we're going to change and we never do. The one thing that can make a difference on this, however, is that if we are accountable to one other person. So before you leave today, I want you and your buddy to exchange your contact information. Yep, and I want you to schedule an accountability call, a buddy call next week. So you can fess up. Yes, I did this. Hooray for me. No, I didn't do a darn thing. Because when we promise somebody else something, we increase the chances that we will actually do it. So before you leave today, set up that 10-minute buddy call where you report for 5 minutes on what you did on the promise you made today, and you encourage your buddy to do the same. And I'm not quite sure if we have the time to do it now, but okay, one last question. One last question. I promised you that you would laugh, you would learn something new, and you would walk away with at least one good idea you could use to be more influential by telling stories and knowing how people's brains work. Have I done my job?
Thank you. Good afternoon, everyone. This is a hard place to fit in. You just had a really entertaining speaker that we all learned a little bit about, so you'll be sitting there trying to decide, am I a looker, a listener, a toucher? So I'll let you figure that out. But happy to be with you all today and talk a little bit about what we do for economic development outreach here in Indiana. If you've got the clicker, I can do it. You don't need to. You want me to do it? Okay, all right. The reason we have the Indiana Economic Development Corporation, our sole purpose is actually just to create jobs for Hoosiers. And that might be by helping businesses that are already here expand their footprint. On the other hand, maybe bringing new businesses to Indiana to establish here for the first time. And we do that with legislatively approved incentives. And so the incentive is to create a job and to add dollars or invest dollars into their business here in Indiana. So when we do that, it's all based on performance. So when you read in the paper that we've given someone a $5 million incentive to set up a business here in Northwest Indiana, and they're going to create 300 jobs, well, they don't get paid a dime, or they don't get a dime of credit until they create the jobs. So it's not like we handed them $500 to get things started. They have to do it first, and then we give them credit. So it's all based on jobs and wages and investment that they have. So what have we done so far in Indiana? We think we've got the best state in the union, and I think you should be very proud of Hoosiers of a lot of things that have happened here and where we've gotten with the state regarding economic development. And it's not something that happened overnight. It's something that the state has put itself in a great position over the last decade to be able to offer a great place to do business. And when it comes to telling people that, the best way to do that is with third-party validation. And that's exactly what we've got, and that's up here on the screen. We're #1 in the Midwest, #5 nationally for the state to do business. #1 in the Midwest, #5 nationally. That's pretty good. Yeah, we're #1 for government efficiency. So our governor is really proud of the #1 for government efficiency, because that means we're running at the best rate that we can, giving the most benefit for the dollar to the taxpayer. #1 for best business regulatory environment. That means that we've got reasonable regulatory environment, but also with that, I didn't realize this before I took this job. Permitting is a public number. So when the Department of Environmental Management has to give environmental permits for a business to start, to build a business, whatever, we have no backlog. Some states have a backlog of a year, 2 years, even 3 years. Well, when you're a business person and you're going to come into the state and you're going to build your plant or whatever, and you want to get started right away, you made your decision, you're here, let's go, and then you have to wait 3 years to get the permits to do it. So that gives us another big benefit that we can say, you'll be starting in about 3 months. You know, so it's really good to be in that condition. #2 for infrastructure, #2 most affordable state, and top 10 for small business policy climate. And by another group, we got an A+ for small business environment for Indiana. So hopefully that makes you feel good about Indiana, and we'll talk about some other number ones as we go on. So if we look at some of the cost factors, it's because we are so close to Indiana, or to Illinois. We like to compare ourselves to our neighbors next door, and there is a little bit of a benefit to be next door to Illinois right now. Things aren't going so swimmingly over there for them. But if you just look at the comparison between Indiana and Illinois, you'll probably deduct for yourself why we have a better state for doing business. When you look at the corporate income tax rate, we're right at 5.75 on a corporate tax rate, but we're going to be down to 4.9% in 2021, where Illinois is 9.5%. They're already just about twice as high as we are on the top side. So that's one big difference. Income tax rate's the same way. 3.23% here in Indiana is what you pay. 4.95, almost 5% in Illinois, if you look right across the line. Local average individual income tax, 1.5, and they don't have a local income tax over in Illinois. So we get a little bit closer, but still they are higher when you just look at their, when we look at local plus state, it's still lower than their state. The tax foundation regarding property tax, so the tax you pay for owning your house, your business, whatever, we're number 4. The top means number 1's the best. We're number 4 in the country. Illinois is 45, because they have really increased their property tax in the hope of making up some difference in their revenue needs. Illinois. Do you live in Illinois? Well, come on over.
I live in both states.
Well, we need to convince you before the end of the day to just come on over here and live with us. The other thing that's a big deal, this is the unemployment insurance tax. So when you have to pay for all of your employees as a business owner an unemployment tax, our tax is 2.5%. Illinois is 3.25%. And we pay it on a wage base of only $9,500, where they go all the way up to $12,690. And this probably numbers don't ring for you, but we've had some businesses be able to literally come across the line and save $2 million a year to get unemployment tax payments. So that's a big deal. That goes right to the bottom line. And the last one is our workers' compensation ranking. We rank number 2, and Illinois 44. So we're quite the dichotomy right now. And things change over time, obviously, but we've been on, as I said, for the last decade plus, trying to get the state into a place that's very appealing to businesses, and hopefully, we want Illinois to come back on track too. But right now, they're not quite up to our level, but which is helpful to us when we're looking for businesses. So attraction and expansion. Looking at the next area. As I mentioned, we're charged with bringing new jobs to Indiana. And we want to do that from several sides of things, but we get what we call competitive projects. So either the business can come to Indiana, or they can go to Ohio, or Texas, or California. Either the business will expand their current plant in Indiana, or they'll expand their plant in Mississippi, or Delaware, or someplace else. So that's what we call competitive projects, and that's where we come in with our incentives to try and convince them that they really want to be in Indiana instead of another state. So what are the numbers so far? So far this year we're at 280 competitive projects. Our goal is 300, and we're going on a calendar year basis, so we're almost through the year. Last year we did about 293. As far as new jobs, the number that we got last year was 30,158, all-time high. That was the best that IEDC had ever done. So the governor was very proud of that. So proud that in his State of the State address last year in January, he, in the first 2 minutes, said, "Congratulations to the IEDC. We're so pleased with setting a record this year in job commitments. So let's do 35,000 this next year." And I'm sitting there listening and thinking, 35,000, 30 to 35. That's like 17–18% increase. I'm not sure that's possible. But so far this year, we've gone at 27,325 jobs on the books as a commitment. And if we could get everything that's in our pipeline, we could hit that 35,000. Not so sure we'll be able to get to that lofty number, but I think we'll be what we did last year. So maybe we'll have another record-setting year. The third one is capital investment, as I mentioned. So far this year, those businesses that have given us commitment, those 293 businesses, have said they will spend $6.4 billion putting investment into their plant and their location. Last year we did $7 billion, and our goal is 8.5. So we're hoping to reach that, yes, but that's all good. The more money we can get somebody else to be spending in our state. But one of the more important things, and you can hit the next slide, is wage. How much are we bringing in? And our goal is to always have high wage jobs coming in to Hoosiers, because that makes sense for all of us. Well, last year, those 30,000 jobs that were committed were an average of $27.20 per hour. Now, to compare, to give you some relevance to that, the average wage last year was $21.51, moved up to $22.32. So compare that $22 to the 27. So anytime we can be above the average of all Hoosiers, we're going to be moving that average up, which is exactly what we want to do. So this year our goal was $28, to try and even move it up higher than last year. We're running at about $26.75. So keeping that number up is what we want to do. And the only thing that changed in that was that little side panel. We were recognized, I think we were, what, 4th? In the ninth highest growth rate of our average wage. So going from that 21.51 to that 22.34, that was 3.5%, 3.74% growth. It placed us number 9th in the country as having grown our wages. So we want to keep that going, and that's one of our primary focuses. So under Northwest Indiana, where have you been? What has gone on up here? In 2017, we had 17 businesses commit to locating and expanding up here with a $661 million investment and creating another almost 1,500 new jobs up here. And when we say commitment, that doesn't mean they all happen in 1 year. It usually takes 3 to 5 years for that company to come in and get hired up, or maybe to spend all the dollars. But to say, okay, do they really happen? I think it's like 92% is the numbers that, yes, they really happen. So we think that's a pretty good rate. In 2018, so far we have 16 businesses, so just one less than the full year last year, at $1.16 billion investment in Northwest Indiana, creating over 1,500 jobs. So we're hopefully doing better than last year up here. So one of the things that we did was in the steel production area with U.S. Steel, we provided them a $750 million investment, and that was to retain 3,800 jobs. So that's just a little bit different than attracting. We really were trying to keep them here, because this was one of those situations where U.S. Steel said, you know what, we have to upgrade our plant. We have to get up with technology, we have to make it more efficient, we've got a lot of things we have to do. We can do it to your plant here in Indiana, or we can go down south and do it to our plant down there. So they had a competitive situation with us and the other state trying to figure out how can we help them choose us. And so we did that by adding some value to them, some incentives to them to be able to retain those jobs, and for them to do that, $750 million investment here in Indiana. Now what that means is those 3,800 jobs will be here, as opposed to if we didn't do this, and the plant wouldn't get that upgrade, those 3,800 jobs would just dwindle until they basically were gone, and this plant would probably be shuttered, because it would not be the plant of the future. So we're hopeful and we're pleased that we're able to get that done. So you can see Mayor Karen is pictured there together. Another project up here was the Premier Biosource up in Rensselaer. And so that's a new research purpose swine farm. You know, ag business is really important to the state of Indiana. You know, we build things, we grow things, we move things, and we'll talk about each of those. But you know, the ag bioscience is becoming one of those areas. We're looking for innovation, we're looking for research and development, and this was important to the ag business to have this type of a farm available to them. So they'll make $7.5 million investment in 21 new jobs. I think we have one more to look at, and this is the data center that got put into Hammond, using a very old building that was basically run down. Anybody familiar with that building that's getting the new data center? No one is? I don't know. It was in Hammond. right on the line. But it was what we call a dino project, and dino is like dinosaur. This is a very old building, had to be more than 100,000 square feet, more than 15 years old, an industrial building. So we were able to give them a tax credit to do all the upgrades to make that building that's fully usable again. And it's going to be a data center, so we'll have a tech incubator, a greenhouse, enhanced public spaces, and all kinds of things around the property that happens to be lakefront property as well. So hopefully it'll be another area that will be benefited, even more economic development coming around it because of that coming there. Opportunity zones. I don't know if anyone knows much about opportunity zones. Anybody in here who's in the economic development? There we go. Legislation came out on the federal level that said to each of the states, if you would like to choose geographic areas that meet certain requirements, and there were the same requirements for the new market tax credits and things like that, that's getting into the details. But they're basically areas that maybe did not recover from the economic downturn that we had in 2007 and 8, and that just weren't up to the standards yet, and they need a boost. So those were going to be called opportunity zones. We had, I think where the number was 500 and, or we had about 600 that met the qualifications. Geographic areas, some small, some a little bit larger. We were allowed to choose 25% of those, or 156 zones that were designated around the state. Now, the benefit comes that if a business will locate there, or if a real estate project will work there, the investor into those projects gets a huge tax benefit. Okay? So it's not a benefit that the state's going to even provide. It's a benefit that the individual taxpayer will get on the federal level. So just a little bit of an example. If you had money invested in a piece of property or in the stock market, wherever, and we know the last few years, the stock market in particular, since 2009, has really been on an upward trend. So a lot of investors have had money sitting here, growing, and they know that if they sell out of that investment, they have to pay capital gains tax, right? And you know how people hate to pay gains tax, so they just leave it there. So this was meant to be an incentive to unlock some of those dollars that have been in some of these other investments. So again, this is the federal government doing this. So if the investor would sell, let's just use $100,000 of their portfolio, they sold that and they created $100,000 of taxable gain. In other words, you create a gain by you buy it at one level, you sell it at the next. So I bought some at $50,000, it's now worth $150,000. I sell it, I get $150,000, but I'm going to pay tax on $100,000. So what the government says, if you take that $100,000 and you put it into a project or you invest in a business located in the opportunity zone, then you can defer paying tax on that $100,000. Okay? So defer is always good. Pay tax later than pay tax now. But the added benefit is if you've been in that project for at least 5 years by 2026. 2026 is the tax year in which we're going to pay our tax on that $100,000. Okay? That's the year of reckoning. But if I've been in a project for at least 5 years, I only have to pay tax on 90% of it. So now I'm down to $90,000 on my tax return. If it's been in there for 7 years, I only have to pay tax on 85%. So now on my $100,000, I only have to put $85,000 on my tax return to pay tax. So that's the first benefit. The second benefit, I put that $100,000 in, and now let's say I paid my tax due on 2026, but then the money's still there, and now let's say 10 years later or more, I could be in there for at least 10 years, that $100,000 investment that I made is worth $250,000. That gain between the $100,000 and $250,000 by sell out of it, exempt from tax. Wow. So you don't have to pay tax on any of that growth. So that's where, I use 100,000 because it's a nice round number. But it can be anything. It can be a much lower number, a much bigger number. But that's the encouragement the federal government, or the motivation the federal government wants to give to individuals or companies that have capital gain as well from their investments, to really realize that capital gain, invest it somewhere to do good, and to help some of these more underserved areas come back up. Does that make sense? Yes. All right. Well, Northwest Indiana has 15 opportunity zones in Lake County and 22 in the total 7-county region. You know, again, I mentioned 156 is what we've got over the entire state, located in 58 different counties, covering 83 cities and towns, more than 1,000 square miles, and about 500,000 Hoosiers live there, the whole state. But let's look at the map, the next one. Oh, there, go back. They were going to put the map in, I guess they didn't get it there. But again, 15 or 22 in the 7-county region. So the way you want to find those, if anybody's interested, you can go to the IEDC website, which is just iedc.in.gov. And down in the right-hand corner is a big block that says Opportunity Zones. Just click on that, you can learn more about it, and you can even find where those exact geographic areas are in your part of the state or anywhere. Economic diversification. You know, we obviously want our industries to be diverse. We don't want everything in one industry, because what happens? Industries go through cycles, and if you're all in one, it's all auto, and the auto manufacturing goes down, or people stop buying as many cars, then your whole state suffers. So we'd like to have a very diverse. Auto is important to Indiana, manufacturing in a lot of other areas is as well. But we're trying to have a very diverse economy. So let's go through some of those. Agribusiness, I mentioned earlier, is very important. $31 billion of economic impact, 108,000 Hoosiers work in there. But here's some number ones. We're number one in commercial duct production, in wood office furniture, and kitchen cabinet manufacturing. We're number 2 for popcorn and ice cream. Now, I don't know if that's consumption or manufacturing. I like ice cream. I think it's manufacturing. Number 3 for total eggs produced, tomatoes, and spearmint. Number 4 for total turkeys raised, soybeans, and peppermint. And number 5 for corn, watermelon, and hog production. So who knew, right? Right here in Indiana, so good for us. Now, I said we move things, and that's all about logistics, how easily things can move around our state and through our state to other places. And we're number 1 in rail shipments of primary metals, number 1 in the country. We're number 1 in the country for highway accessibility. Of course, we all sort of knew that. We're the crossroads of America. We've got all of those interstates, and they really are very attractive to businesses who need to distribute their goods or bring in their sources of materials from other places. So we get looked at a lot from that type of thing. We're number 1 airport in North America, the Indianapolis International Airport, by a variety of groups have ranked us number 1 for the last 7 years. And it's a beautiful airport. The nice part about it is it's really been built. It's the only airport that was built from the bottom up since 9/11. So all those security things that they wanted to put into place after 9/11 were able to be built efficiently into our airport. And that's what gives us a lot of the benefit that we're experiencing now. Number 2 largest FedEx hub, right here in Indianapolis at the airport. Their number 1 FedEx hub is in Memphis, Tennessee. Now the benefit that we have, we will be coming number 1 at some point in time, because Memphis, they're all blocked in. They can't expand down there. They can expand in Indianapolis. South of the I-70, you know, we own that land down there. They can do another runway and various things there. So we eventually will be number 1. They're right now in the middle of a $1.5 billion capital improvement in that area. So, and I'm going to throw these numbers out. They now do 99,000 packages, I think an hour. Wow. Over some time frame. Now, see, I've got, well, I can make sure I check that number because I said it last night as well. And it's going to increase to 149,000 over whatever that time period was, the hour or the day or whatever. I bet it's an hour. You should see the number of planes that go in and out. So if you have a package lost, come down to the FedEx station. So they do a great job. So again, we hope to see that increase. Advanced manufacturing. You know, when we talk about manufacturing, we sometimes have a little bit of an issue with maybe our young kids coming up. It's a factory. I don't want to work in a factory. It's dirty. It's heavy. It's all those things. Not anymore. Advanced manufacturing has turned that around. GE Aviation, which is right down 65 at Lafayette, they make jet engines. It looks like a clean room. I mean, there's no dirt, there's no grime, a clean facility, is basically what I'm saying. And they do everything in teams, and the most of it is done through technology. They're sitting there measuring tensions, they're doing this, they're doing that, they don't lift anything, the whole jet engine as it goes through its process is on these axes, and it's not like you might think, okay, everything goes down the line, and there's assembly. The team of people work with it all day, move it along, do whatever they need to do. It's just amazing. So if you've got young people in your family who are looking for something that might be creative, work with technology, and do something that's really amazing, when you see these jet engines, make sure they think about advanced manufacturing in some of these different areas. We are #1 globally for RV production. So anyone who has a recreational vehicle probably was made right here in Indiana. We make 80% of the world's RVs. We're the only state with 3 Japanese automakers. That's a pretty big deal. We have Honda down in Greensboro, we have Subaru in Lafayette, and we have Toyota down in Princeton. So kind of dotted around the state. And they make great vehicles, and the ones that are getting very, very popular, so we're pleased with that. Second largest automotive state by GDP. So we produce a lot of cars here. Highest concentration of manufacturing jobs in the U.S. We have 8,500 manufacturing facilities supporting about 20% of our Hoosiers. 1 in 5 Hoosiers work in the advanced manufacturing area. Life sciences is also big as well. So Warsaw, Indiana, the orthopedics, we are called the orthopedic capital of the world, so anybody that you know that's getting a knee replacement, a hip replacement, you can tell that part of them is now made in Indiana. Probably was. More than 1,600 firms supporting 55,000 jobs. So #2 in life science exports. Here we go. Technology. Who would have thought Indiana's becoming the technology hub between the 2 coasts, and now we have Indiana. But we are top 10 fastest growing tech communities by Forbes magazine. So it's got to be true if you read it in Forbes, right? #4 fastest growing tech jobs, and that was from CBRE. 2017, and in 2017, the job commitments that we brought in, the pay is high, $36.57 an hour. So remember those earlier numbers that we were talking about? These are the high-wage jobs that we try and attract through the technology sector. 18 Indiana-based companies made the 2018 Inc. list of fastest-growing companies, so we're pleased to see that as well. So we're really attracting that type of business to Central Indiana, and always, where's our talent coming from? And when you think about IU, Purdue, Notre Dame, Rose-Hulman, and all of the other colleges and universities that have it here, we're producing that type of a talent now. And the governor did put a program in place where by a certain date in the future, not too far off, every grade school will be teaching coding. Maybe grades will make high school. Every school will be having a coding class because that's how important technology is. Understand it from the ground up. And that's the kind of talent pipeline that we're going to need to have. So aerospace, aviation, and defense, another sector that we're interested in. Again, high-wage jobs falling in there. We had a 13.5% increase in our exports in this area. We have Rolls-Royce, BAE Systems, we have Raytheon, GE Aviation, I mentioned right here in Indiana, and the top 5 largest defense manufacturers all have locations here in Indiana. So that's good for us as far as that goes. And hopefully those jet engines and that nice little jet there will be made here. Next. Connectivity. For us to have a growing economy, we need to be connected. We need to be connected in all ways possible. So the governor, if you mentioned earlier, came out with a new program, a $1 billion initiative, all on connectivity. And actually, where's the money coming from? You know that toll road you guys have up here? Yes. And the truckers are going to be paying a little bit more to use that? Okay, this is going to blow your mind. It did mine. I'm sure I got these numbers right. When you see a semi going down the highway, they're heavier, all that kind of stuff. How many cars do you think that's equivalent to going down the highway? What? Say it again? 10. and 100,000. I know. Wouldn't that drop you out of your chair? 100,000 cars. Because of the weight, you know, they have all of those big vehicles, the wheels. So when they go down the road, they're doing 100,000 times as much damage to the road as what you're doing. Yeah, so let's not worry about them paying a little bit more to use it. And we're still lower than most places in the country with the tolls that they're going. Well, anyway, the governor's going to get $1 billion out of this to spend for other things in Indiana. And he started out with broadband. You know, there are some parts of our state that do not have strong internet connections. So if you own a business, are you going to go there? If you're a family with children who need access for learning, are you going to go there? And we even hear stories of families taking their children to, you know, Starbucks or to McDonald's just to be able to use the internet. We can't do that, and that's they understand it. We need to be connected through that type of broadband. So he's dedicating $100 million to some of the areas within our state and try and bring them up. The other thing was quality of place assets, linking our communities with hiking trails, biking trails, walking trails, running trails, whatever. And he's willing to put $90 million into that project as well. We've got a lot of trails started in Indiana, a lot of them running next to some of our rivers. You know, a little bit about rivers. You know, way back, rivers were used for industry, to carry waste off, to make production, that type of thing. And now that we've gotten away from that, our rivers were just there. They needed to be a little bit cleaned up, and now people have done that. We've done that throughout the state. And now people are turning to the river, understanding how nice it is to view it, to watch it, to be next to it, to use it as an actual asset. And so building these trails that will connect communities will be great, and that's the kind of quality of place that people are looking for. You know, you have to want to live in an area to go there to work as well. So that's the attraction side. So we're going to add $90 million to that effort. Major highway projects. Let's finish I-69, right? We finally got that Bloomington and South. If anybody traveled on I-69, and that Bloomington section going south was under construction forever, so the state took that back, got it done. In fact, it was still at 30 miles an hour. I'm here to tell you, you know, there's 70 miles an hour through that area, so that's all good. But now it's the Martinsville to Bloomington that needs to be done, and that was scheduled to be done really over the next 6 years or so. He wants to speed that up. He wants to speed that up, and he's willing to dedicate $600 million to get that done quickly. Now, most of us would automatically think, okay, that gets you from Fort Wayne to Evansville. Big deal. It does, but it also completes the link from Canada to Mexico. Think about trade. Think about economic opportunity. That's huge. So that will finish that link. And actually, it saves us money, because when you think of it, we had money in the budget for the next 6 years to do that. That money can now be freed up to be used for something else as well. $190 million would add to new interchanges for 31. So going north from Minneapolis up to South Bend area and that central part of the state, there's an awful lot of stoplights there now. So he wants to make that a smoother trail, take out most of those stoplights, if not all of them. So $190 million will be dedicated to that, and NDOT's going to do some things to clean up highways. That's always important too. So I don't know how much they get for that, but it's a focus on cleaning up the highways, which will be good. Another area is international flights. We have one nonstop flight to Europe. We have Mexico, Canada, that type of thing. We've never had one going to Europe. We'll talk about that in a second. But it's the Paris flight. Has anybody been on the Paris flight? All right, there you go. Did you love it?
I did.
Yeah. You what?
I flew out of Bulgaria.
You flew out. You came back. Did you come back on our Paris flight? Okay, good. I was talking to somebody just the other night who said it is so convenient to actually fly over to Paris and take the train to London, as opposed to even getting on another flight. But you can get from Paris, you can just about anywhere quickly.
Is it from Indy to, is it Air France or?
Delta.
Oh.
It's Delta. Well, I'll talk about that in a second. Let me get through this and we'll go back to that one, but thank you. So we're going to add $20 million more to the area, giving incentives to airlines to make those flights. And I'll explain all that in a second, but adding 20 million will help us get more non-stop flights, probably to Mexico, looking at Japan, you know, some of those other areas as well. And waterway connections, we're looking at adding a 4th port. We now have one up here on Lake Michigan. We have 2 already on the Ohio River, and we want to add a 3rd, which is kind of the southeast corner of the state at Lawrenceburg. So we're going through all the due diligence right now to see if that makes sense, you know, looking at environmental cleanup, blah, 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 blah. So, but we're looking to hopefully do something like that, again, spurring a lot of economic development. And then rail service. That's going to affect you up here. Double tracking the South Shore. It's going to be huge. Huge. I mean, it's going to get you so much in the, so much more economic development up here, because when you think about it, from Gary to downtown Chicago, 20 minutes, you're a suburb. You're a suburb up here. Who would, remember that chart we saw? You want to live in Indiana, or do you want to live in Illinois? Live in Indiana, but enjoy the benefits of the big city, because you can get there in no time at all. But also, from South Bend, Notre Dame, you know, getting into Chicago is like a 2.5-hour travel time on the train. It's going to go down to 90 minutes. From the middle of our state all the way over there. So again, more economic development will come from that. It'll help Notre Dame in attracting talent. You know, that was one of the things that they said as well. You know, we can attract maybe a great professor, great administrative person, whatever, but then their trailing spouse says, where am I going to work if we're in South Bend? Well, now they fairly easily work in Chicago or somewhere close by. So there's a lot of benefits we're going to get from that. So we're pleased, and more money is going to be put to that project as well. Okay, South Shore, we just talked about it. Forgot I had a slide in here, but it's going to be faster commute times, increased service frequency. An investment of $180 million is already allocated through our state budget for that, and so now we're pursuing that federal funding that's important to get this thing going, but it's going to happen, so it's going to be great. Here's that first transatlantic flight to Paris, and I wanted to note the $5.5 million that we're giving as incentive to Delta to do that. So you've got to understand, okay, put your airline CEO hat on, and somebody wants you to start a flight from Indianapolis to Paris, and you say, I don't know if anybody would even take this flight, so I've got a lot of risk here. I don't know if they're going to come and fill the seats. So that's where the state comes in to say, okay, we're going to give you a safety net. We're going to help you for the first couple of years, help prove to you that this is going to work. Now, we have done business cases, so we find out how many business travelers would use this. We love the leisure travel as well, but we have to base it on a business case, because that's the one that's going to be there all the time. So we find out what businesses want that connection, et cetera, and then go to the airline and say, we'll help you do this. And the incentive package can go one of 2 ways. One, it can say, okay, let's all agree on what your profit needs to be, and if you fall short, we'll shore that up for the next 2 years, 3 years. Or we can say, we're going to give you an added incentive to fill that for yourself. So for every passenger you get into a seat, we're going to give you X dollars. So we've done that kind of deal with this one. So over the next 2 years, I think it's $3 million the first year and $2.5 million the second year is the max that we'll give them to help them prove that this is going to work. Now, a little unknown benefit that came along that helped this was GE Aviation that I mentioned. They need to get their jet engines to Saffron, I think is the name of the city, right outside of Paris. And they've been taking big trucks, loads of these things up to O'Hare every day to fill the belly of an airline there to go over to Paris. Well, guess what? It's a lot easier to come down to Indianapolis and use these new flights. And so Delta and GE have already gotten a contract in place where they're guaranteeing space every flight that goes out. So what a big help that was for this case as well. So we've got that, like I said, we've got $20 million now that we're going to be able to do more like this, again, looking at more nonstop transatlantic or transpacific flights. So we'll see where that goes. Some things that are happening at our regional airports up here in Gary, Chicago Airport. We're looking for opportunities or evaluating opportunities to expand the service out of the Gary Airport. You know, South Bend now has 12 nonstop destinations This past year, we got the Dallas, Fort Worth, and Charlotte nonstop started out of there. Fort Wayne has 12 nonstops. Philadelphia was added just this year. And in Indianapolis International, we now have 51 nonstops going out of there. And I just mentioned the Paris, but also Oakland, San Diego, Sarasota, Bradenton, Charleston, Phoenix, and Allegiant crew base came out in the last couple of years and added to that airport. And then we have Evansville, where the 7 nonstops, and Destin was added this year. And they also invested $20 million in that airport down there. So we're spreading it around the state. Yes?
I read recently that there's a shortage in pilots, and there's going to be an increasing shortage in pilots. Gary used to have an aviation program that was like more robust. My understanding is it's slowed down, if not stopped currently. Is there plans to like increase an aviation program in Gary to like allow our people in the region to become pilots?
You know, I didn't know about that program up here. Do you remember who ran the program?
I don't know a ton about it. I know it's come across me recently.
Okay, well, we ought to check into that. But to answer your question, Republic Airlines, which is actually headquartered in Indianapolis, they're a regional carrier. They actually work with United and some others to do their short haul. They are starting a pilot school in Indianapolis at the airport. And so that's just starting right now. So it sounds very similar to what someone was doing up here at one point in time. Because there is a pilot shortage, and they hope to put in, like 400 pilots a year coming out of that. So everyone's very excited about that possibility. They haven't started yet, but it's got to be sometime in 2019 that they'll get started. But you're absolutely right on.
I have a question. A lot of the projects that you're talking about, the toll roads, the railways, the fact that Gary does have an airport, and there are lots of truck stops in that area, is any of that money going to be allocated towards that area?
Well, the double tracking is going to get done there, and there'll be, obviously the trails, the broadband, all of those things from that $1 billion initiative. If an application gets made, and if there's projects to be done up here, absolutely. But, yes. So we just started, he just announced it, so we don't even know how we get people to apply. But if you've got a group of people and trails are of interest, your regional development people, and you've got a great region up here that does economic development planning, should really build that in and look at opportunities to seek some of this funding. You're very eligible. So, okay, 21st century workforce. So we bring all these businesses in, and the first question is, where do I get my talent? Where's my workforce coming from? And so the governor did create a workforce cabinet, really basically to, again, shine a light on what's the issues that we've got here. I was part of that cabinet, still am part of that cabinet, and we've gotten through so far evaluating kind of all of the workforce programs that are available in Indiana from the Department of Workforce Development and others. And which ones are effective, how much are we paying for that program, where do we get the best bang for our buck, and now we're to the point now where we can start making recommendations. That was kind of the committee I was on. There's other committees that came out of the workforce cabinet that are looking at education. We've got to back up, and we've got to make sure that our students coming out of high school are ready to be employed. A number will go to college, and that's great, but that's not their only option. And sometimes we look back and we think that maybe as parents, we were too persuasive to say, you gotta go to college, you gotta go to college. You don't have to go to college to get a good paying job. You need maybe that extra education past high school. But what we'd like to do is see a lot of students get that opportunity to get a certificate or get that added education for a job, get that skill, whatever they need for their local employees by the time they leave high school. And then to understand that, yeah, you got this certificate and now you're starting to work maybe at $50,000 a year. Now, are you going to be stuck there? No, but you may need to get that next certificate and then you jump up to 60. And the next one will qualify you for something even more. So there's definitely a path, and we need to show that. And so we're going to start with our educational institutions and give them that direction to say, how do you work with your local employers? How do you understand what skills they need, and how do you build that into your curriculum? And that's the goal that they're doing from that side. So we're trying to hit this from all different ways of how we put a workforce that's got the right talents for the jobs that are being created. So we're looking at the education side, we're looking at the programs that we have, and the third place, how do we remove barriers? You know, some people can't be in the workforce for a variety of reasons. It may be the opioid crisis that we mentioned earlier. So how do we help people get through that problem? It could be transportation. It could be childcare. It could be a disability. So we're looking at all kinds of ways that we can make sure that all those different populations can come back into the workforce in the areas that they can apply. So, you know, when you look at the disabled, the individuals with disabilities, those who could work, 80% of them are unemployed. They just haven't had the opportunity. We've got to get employers to understand the value that they can get from that population as well. So those are the kind of things that the workforce cabinet is really looking at. So hopefully we're now to that point where we can start making some recommendations. So hopefully you'll see something of that soon. Next level jobs, there was a program that was put out just last, sorry.
Will there be some type of educational reimbursement given to the program with the employer federal assistance while they have those high school students coming in? Okay, we're making $50,000 this year. We want to do the $60,000 next year. They have to pay for that education somehow. Will that be written in the?
Here comes the program you've been waiting for. They did next level jobs. The first one they are called Workforce Ready Grants. So if someone wants to get, whether they're in high school, out of high school, but usually be out of high school and in the working or not working communities, if they would like to get that next certificate, tuition paid free at Ivy Tech or Vincent's University. Now that may actually get expanded, but that's the program that I think probably would fall in there. But the second program can fall where you're talking as well. The employer could apply for grant money to help educate their current employees, and that is in place. It's very popular. $5,000 per employee, $50,000 per employer was the max. And this was really meant to be those smaller companies, not the great big ones, but the smaller companies that maybe have a harder time figuring out how to educate and how to continue to upgrade the skills of their workers. And that's very popular, and I think the majority of the money that was set aside, I think, has been applied for. But we still have people that can apply in the Workforce Ready grants to get that free tuition. The other thing I'll mention on this is that the governor did create a new secretary position of Career Connections and Talent, and Blair Milo, some of you may know, was mayor of LaPorte, Indiana, took that position last September, so she's been in a little bit over a year. I think we have some numbers on the next slide about the Workforce Ready grants that I just mentioned, and you can see that up here in northern Indiana and Lake County, over 2,000 individuals have taken advantage of that program. So you can see kind of how they went around the state. I think every county we have individuals who've taken advantage of the program. So, and you can see it's been in health and life sciences, IT and business, advanced manufacturing. The top counties are Marion, Lake County, Allen County, Hamilton County, and St. Joseph County. So far, 539,000 visits to the website. So, and almost 27,000, almost 30,000, excuse me, completed applications. So that's 30,000 Hoosiers that are getting free tuition to kind of upgrade their skills. Attracting talent. We need to be able to have a place where people want to come and either stay because they're here in the first place or come and live and work here. So that's when the Regional Cities program was started in 2015 with that in mind. And I don't know if you recall, but there were 7 regions around the state who came with plans of here's what we need, here's the quality of place assets that we need in our area. And 3 of the regions were selected to receive seed money of $42 million. Those areas were Northeast, so kind of Fort Wayne and 10 other counties. Southwest, kind of Evansville, I think there are 3 or 4 other counties there, and North Central, which is South Bend, Elkhart, and the surrounding counties. And what they did is they presented projects that we need a medical center. The first project that was done under this was a medical center, medical clinic down in Posey County, southwest corner of the state. And we did the ribbon cutting there, and a lady actually said to me, I can now go to a doctor's appointment without driving 50 miles both ways. No, one way. So 100 miles both ways. I mean, and that's a quality of life when you don't have, when you can go to the doctor right in your small town. So far through that, we have 62 projects that have been approved for the 3 different regions, equaling $1.25 billion of investment. About 120 came from our funding, from the state funding. 18 projects are completed. But the thing that came, we know this works. We know that groups come together and they plan regionally. it makes sense, because when you think about it, if I'm a developer and someone says, we need an apartment complex, and, you know, 5 counties coming together to say, we need that apartment complex, it takes a lot of risk out of building that, right? Because you know everybody wants it and needs it. And so the private developers have been willing to put more money into these projects than when we actually planned for it. Originally, we thought 20% from the state, 20% from local, 60% from private investors. We've done about 10% from the state, 15 to 20 from local dollars, and almost 75% from private investors, money coming into these projects. So for every dollar that we put out into the state, somebody else has put in almost $10. So it's a good ratio. It's good leverage, and we're seeing that improvement is changing those areas. And then if that project gets started, sometimes even without our seed money, other projects get done. You know how that spreads. So good economic development, good quality of place projects. Am I almost out of town? Is that what you did? Out of time? You're going to kick me out of town. Okay, we'll go through the rest of them really quick. Next. You all just did a great plan up here called the Northwest Indiana Forum. Did a plan. Go to that website if you want to read about what their regional economic development plan is for this corner of the state. Next. Innovation and entrepreneurship. Only a couple things here. We have something called the Next Level Fund. Again, the governor got this started last year, where $250 million was moved into a fund that is meant to be an investment into businesses that need scale-up money. You know, they get started, they get their clients, they get their service, they get to this next level, and to grow more, they need more dollars injected. So that was the purpose of setting up the Next Level Fund. And what we're doing is we're putting money out into venture capital funds. So somebody who's got a fund out there like High Alpha or Alos, if any of those names sound familiar, those are funds where investors put their money in, and then the manager of the fund chooses what company that they invest in. So we put some of the Next Level Fund money into those kinds of funds. $250 million will get invested over the next 5 years, about $50 million a year. And so we've got that process started. The whole idea is to build our own, to help businesses that are located here to grow here in Indiana. So we're excited about the potential there. Now this I have to tell you about. Innovate within pitch competition. How many have high school students? All right, grandchildren that are high school, whatever it might be, listen up, because we started this project last year. Think Shark Tank. You know, when you go and you pitch your business and you basically are trying to get investors, the sharks, to invest in you. What we did in high schools last year in cooperation with Ball State University and the Department of Education, we said, create a business plan, get a little team together, create a business plan, and we're going to have competitions. So we had 65 schools get involved, 86 total pitch teams, and about 293 students, because you could have more than one person on your team. So they did the regional exercise, the regional pitches. 9 winners came to the state. Now, I showed you those numbers. We think we're going to have 2 or 3 times that this year, because again, last year was a short period of time to get things started. But here's why. The prizes at the state level, they did their pitches, 7-minute pitches. We asked questions about 5 minutes. We had a first, second, third place. The prize for third place was $1,500 for each team member, cash. That was 1 to 3 members could be on, 1 to 3 members on a team. So students on a team, so up to 3. Second place was $2,500 cash for each team member. Okay, listen to this. First place, $10,000 cash for each team member. 1 year free tuition to any college in Indiana, maximum $10,000 value. An internship, a paid internship, we had one of them at the IEDC this last year, and a mentor to help continue building on their plan. So this is worth doing. And we're right in the process now of getting those teams created in the schools and getting their applications submitted. So what you might do, if you have a business or if you have some time and an opportunity, is to work with the schools, help those teams get organized and get moving forward, offer internships with them, be a mentor, or sponsor the competition, maybe even be a judge. So if you're interested in that, we can provide more information on that pitch competition. Again, going to our website, you'll find a way to find more information. So small business development centers, I always love to talk about this. We have 10 around the state. They give free advice to businesses who want to get started. And not even after the time that they're started, we continue to give them advice on various areas. We have 247 businesses have been started so far this year by our small business development centers. 815 jobs were created and $77 million of capital investment. We also have what's called PTAC, Procurement Technical Assistance Centers. If you have a business that would like to have a government contract, either on the federal, state, or local level, they can help you do that. They can help you go through that process to be able to apply. So far this year, we've got 300 new clients, and we have secured almost $63 million in government contracts for those clients. And 255 more jobs are created because of that. The next slide is going to show us where your center is here. Northwest Indiana Small Business Development Center, the director is Lori Felt. You can see she's in Crown Point. Her partner institution is Purdue University. But the services that they provide listed there as well. If they need to get a business plan started, you or someone else wants to start a business, we can help you get your business plan started. If you need to go to the bank and get financing, we can help you do that. If you need market research, if you decide, okay, I'm going to start this business here, but do I have potential customers here? Do I have a lot of competition here? Is this the best place, or should I be over here? They'll do that market research, which is an expensive endeavor. They'll do it for free. They'll do it for free. They give export assistance and business valuation assistance. So we've got a lot of businesses that have been very successful getting started. In fact, I was down in Fort Wayne, and there's a woman who has a business called Olive Twist. It's a little retail store that sells all kinds of olive oil and that type of thing. And she actually told me that she thinks working with the Small Business Development Center saved her 1 year. She said, I knew all these things had to be done to get it done, but I just couldn't get it going. I didn't know what order. And working with the Small Business Development Center, she said it saved her 1 year in getting the business up and running. So there's value in those businesses. So the advisors are on the next slide. And you can see Bill Gregory, Cindy Bertram, and Gary Brownlee are business advisors. I think we have a couple more on the next slide. Kenneth Gonzalez and Ron Gifford. So those are the people up here. And most of them, if not all of them, have done this before. They created their own businesses, they've been business owners, and now they're kind of giving back through their services. The PTAC office, Diana Hunter is the person up here. And again, with that, it says one-on-one counseling, subcontracting. It says bid matching. When the federal government, you got to match the bid. You may have to find partners, proposal preparation, workshops and events, all of that again for free. I only have 1 or 2 more. Women in business. This is the last one. I promise. We have been going around the state and bringing women together. We've done one in Bloomington, in the Evansville area, the Fort Wayne area, and we're coming to Northwest Indiana. We're going to be here next year. It'll be after the first of the year, probably January or February, because we always like to bring the First Lady Janet Holcomb, and Lieutenant Governor Suzanne Crouch will be with us. The 3 of us kind of host these events. We've had panels that usually speak individuals from the area, women who have been very successful even in corporate life or starting a business, and we just had them tell their story. And we've gotten, I think the very first one we did, we had 100. I think we did the next one, we had 200 women. So it's been fun, and we think that it's important to bring women in business, women who work for corporations, women who work for philanthropies and social services organizations to come together and just come talk and get to know each other and find ways that they can collaborate. So we call it Connect, Collaborate, and Celebrate. So we hope to do that. Ta-da!